Northeast, those numbers are there. You're seeing people going into hospital and getting very, very ill. In London, we've got something like 1/7 of the cases per 100,000, and we're in tier 2. So where is this judgment against you, or this, where is this resentment? Is this historical?
Yes, I thought that's the question you were asking, actually. I think when it comes to investment, jobs, unemployment, there is a long history of the North, in my opinion, not getting a fair deal. But if you go back to March, just dealing with the COVID situation, the figures in the English regions were lower than they were in London. Everybody was locked down. It hasn't worked. It kicks the can down.
That was wrong, right? If that was wrong, then it's wrong now.
Yes, I think the lockdown was wrong. I mean, we're going over the same ground. I think you have to.
All right. Well, listen, I'm going
to deal with that as a public health emergency and do something that is effective, which isn't being done at the present time.
Graham Stringer, thank you for your time. Labour MP for Blackley and Broughton in Greater Manchester. At 9:59 is the time. Coming up at 1 o'clock, it's Majid Nawaz. It just remains for me to thank you for your company and your time this morning. I'm back for weekend breakfast between 7 and 10 next Saturday and Sunday. I look forward to your company then. Next up, and live from Westminster, it's Tom Swarbrick. Hi, Tom.
Andrew. Hi, Andrew. Thank you very much indeed. Yes, morning, everyone. Welcome to the show. At 10 o'clock.
We are looking very carefully at introducing a time-limited fire break. This would be a short, sharp shock to the virus.
Wales has shut the border to those from COVID-affected areas and now looks set to head into a circuit breaker.
In just over 2 weeks, there will be more COVID patients in intensive care than at the peak of the first wave. I cannot stress enough, time is of the essence.
A leaked document suggests that later this week, Wales will enter a 17-day lockdown with pubs, restaurants, hairdressers and cafes all closing. Is this needed elsewhere in the UK? And why is such a damaging tool still being used more than 6 months into this thing?
On your radio, on Global Player and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 10 o'clock, there are concerns about police in England being allowed access to the contact details of anyone failing to self-isolate properly. It's confirmed by the government. Information will be available to forces on a case-by-case basis. Professor Sir David King's from independent SAGE, which sets itself up as an alternative to the government science advisory body. He worries it could undermine the whole test and trace system.
If they are relying entirely on the app, I think this can only mean that people will simply not sign up to the app or will cancel that. So, I don't think it's helpful. I think equally the £10,000 fine for somebody who's told to isolate and doesn't isolate, I don't think that's the answer.
A government minister's denied a 2-week circuit breaker lockdown for England will be imposed. Labour believes that would allow the spread of coronavirus to be reversed across the country. The Shadow Education Secretary, Kate Green, hopes it could allow for lab capacity to be increased for testing. But Michael Gove feels England's tiered restriction system works best.
It would seem to me to be an error to try to impose on every part of the country the same level of restriction when we know that the disease is spreading more intensively and quicker in some parts of the country.
It's expected the Welsh Government will confirm tomorrow if there's to be a wider circuit breaker measure taken there. A leaked letter by the CPT Transport Union suggests it'll start Friday evening and run for 17 days. The Shadow Health Minister for Wales, Andrew R.T. Davies, isn't convinced by the decision-making process.
The First Minister is quite selective in the advice he takes off SAGE. Only last week he was taking the headlines by storm with his ban on English people coming into Wales, and yet SAGE in that instance said that would have a low impact and they had moderate confidence that those travel bans would have any meaningful effect.
Tony Blair's denied reports he breached quarantine restrictions by failing to self-isolate for 14 days after returning from a trip to the United States. The Sunday Telegraph has pictures of the former Prime Minister leaving a restaurant in London's Mayfair 10 days after getting back from Washington. His office says he'd been told to follow guidance on international conferences, which gives diplomatic exemption. Travellers arriving in Britain from Italy now have to self-isolate for 2 weeks. The quarantine restrictions also apply to anyone returning from San Marino and the Vatican. Holidaymakers returning to England from the Greek island of Crete are no longer affected. The weather, some early mist and fog clearing, then mostly cloudy again with a few sunny spells. More drizzly for parts of northern England, Wales and Scotland today. A high of 15 degrees. From Global's newsroom, I'm Bill Overton.
This is LBC from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick, live from Westminster.
Just gone 10. Hello, good morning. Welcome to the show. You are listening to Swarbrick on Sunday, live here on LBC and in full Technicolor on Global Player, YouTube and Facebook too. I'm Tom Swarbrick. Hope we find you very well this morning. On the show, the NHS heading into the perfect storm as winter arrives. A flu jab shortage, lack of staff and test shortages too means the health service is being severely strained. Should more be done to protect it? A former health secretary joins us. We'll speak to frontline workers later in the programme as well. Plus, Labour's shadow education secretary calls on unions to shut schools for 2 weeks over half-term to drive down the virus. We'll speak to her to see whether she agrees. And the CEO of Greene King, the pub retailer and brewer, will join me as the trade demands more support.
Call 0345 6060 973. Tweet at LBC. Text 84850. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good morning to you. There are reports this morning that Wales looks set to become the first part of the United Kingdom to head into a full-scale circuit breaker. This comes from a leaked letter from the Welsh Government that suggests that pubs, restaurants, bars and cafes will all be closed for 17 days from 6 p.m. on Friday, with an announcement due tomorrow based on a decision that we understand is being made almost as we speak. It's not yet clear what will happen to schools in Wales, but some schools, according to this leaked letter, will reopen after half-term in November the 2nd, the implication being that some will remain closed until the 9th of November. This is despite cases per 100,000 in Wales being way below those of areas in England just across the border. If you live in Wales, do you feel that you now need a circuit breaker? You now need some schools to close for 2 weeks. For 17 days, you need to see the pubs and the cafes and the restaurants and the bars shut. Would you want to see these measures for the rest of the UK? Because as has been noted, there are parts of the United Kingdom, parts of England certainly, and Scotland that have higher cases per 100,000 than anywhere in Wales, and yet they are not countenancing a circuit breaker right now. We hope to talk to Steve Rotherham, the leader of the Liverpool City region, which of course has very high cases per 100,000. Let's turn first this morning to Lord Andrew Lansley, former Health Secretary, former Leader of the House of Commons and Conservative Life peer. Thank you very much for joining the programme this morning, Lord Lansley. Good to have you on. Let's start off with the idea of a circuit breaker in what looks like for Wales. Do you think this is a technique that is justified by the figures and the cases?
Well, of course, actually, overall, the number of cases in Wales is lower than the overall rate in England.
Quite.
So the point is, in Wales, in some parts of Wales, the figures are very high, particularly in some of the areas near the valleys in South Wales. So I think, from my point of view, what you've really got to do is distinguish between places where we need to maintain downward pressure and don't necessarily have to have a constant change in the character of the restrictions that we put in place, as compared to the places where it's at real risk of getting quite out of control and overwhelming the NHS. And under those circumstances, we have to have a harsh lockdown. But to apply the same rule right across Wales when, for example, I have relatives on Ynys Môn and Anglesey, the rate is not high there, it's quite different from what it is about 30 miles away in Conway. And it doesn't make sense necessarily to have the same restrictions in those two places.
So Boris Johnson is right, ultimately, you think, to argue against what Keir Starmer is looking to do, which is a national circuit breaker?
I think he is right, but I think where the government is not right is in reliance in the places like where I am here in Cambridgeshire, where, and indeed I see some Conservative MPs arguing, and I can understand it, against a sort of general lockdown of the kind that Keir Starmer is advocating. But what we do need here, I think, is we need to maintain downward pressure, and the rule of six has not proved effective. It's simple, but it's not effective. And so
Why
I
is
think
it not effective?
Well, because actually people are still mixing between households, and I think the evidence, I'm not an expert, but the evidence that I've read is perfectly clear that mixing between households is one of the overwhelmingly major causes of transmission of infection. And of course, rule of six, and people are saying, well, it's a rule of, it's different people every day, and that can't work. What we've got to do, I think, across the country is have is limit mixing between households. But what I would say is I think mixing between households in their own homes indoors, because outdoors is different from indoors, and in COVID-secure places like gyms and hospitality and leisure facilities, their economic circumstances demand that if they can make themselves COVID-secure, we let them stay open.
So how do you do that? How do you knock on the doors of individuals' homes to see who's in them? I note that the track and trace info is being given to the police. Is that something that you think is a good idea?
Well, as it happens, Tom, I don't. I think when you go back to the earlier part of the year, there was a major lockdown which was effectively not enforced by legal penalties. We seem to have shifted into the idea that if it's not illegal with fines, we're allowed to do it. Well, in fact, of course, earlier in this pandemic, people were behaving responsibly, and they were doing so without fear of penalties and fines. Mm-hmm. And frankly, I think that's where we should be moving to. We should be moving to, not imposing lots of penalties and fines and people wondering what they can get away with, but looking to people to work together, to be responsible, to take responsibility in their own home for who comes into their home, and making sure that they form, their own very tight social bubbles, and they don't mix with other households beyond that. Because this is a marathon, not a sprint. We could be, when Boris Johnson said got to think it may be 6 months. It may be 6 months. We're talking about a vaccine now in the new year. And in the first instance, it will only be for the most vulnerable groups. They have some special needs. It could be longer than that. Yeah, no, you're absolutely right.
So the idea that people would take responsibility for who's coming into their homes for a year and a half, 2 years.
Who can say? The point is that if we, what I don't think, and I'm speaking entirely personally here, what I think would be really people would find intensely difficult is a constant change in the nature of the restrictions, not only different things in different places all over the country with a sort of patchwork quilt of restrictions, but also for people in their own location to be finding that the rules are changing. That's why I hate the idea of a circuit breaker, because one day you can, the next day you can't, 3 weeks later you can again. But at which point we're all looking at the data on things like hospitalisations and, sadly, the fatalities data. Yeah. And the point at which it's relaxed is the
Andrew,
point at which those figures are the worst.
Quite. Can I just ask you one final thing, which was about your time in office as Secretary of State for Health, and particularly in relation to Public Health England, which is now being done away with, being scrapped. Do you think that's the right decision? Do you think Public Health England has performed well?
In favour of what? They will scrap. I mean, I'm sorry to say this, Tom, but you understand these things. In government, there is a tendency to scrap an organisation, in inverted commas, get rid of its name, get rid of the bosses, set up a new organisation that, to all intents and purposes, has exactly the same job. If what they do is they say, right, we're going to have, instead of Public Health England, have two bodies, one of which is responsible for effectively non-communicable diseases, the things which actually kill the most people, like obesity and smoking and drug abuse and so on, the lifestyle issues, and another one which is responsible for control of infections, like the old health protection organisation. Having two organisations doesn't help. Public Health England, it may have made mistakes. In fact, it has made mistakes.
Definitely has.
But the point is, then reform the organisation. Don't go into an organisational change.
OK. Andrew, great to talk to you. Thank you for your time. Lord Andrew Lansley, former Health Secretary, former Leader of the House of Commons, Conservative Life peer. Let's get up to Liverpool. Steve Rotherham joins us on the programme, Metro Mayor of the Liverpool City region. Thank you for coming on this morning, Steve. Let's first ask about Wales and the restrictions that seem to be coming in as of next Friday, a possible circuit breaker. Do you think that might be required for your part of the country? And if not, why not? Good morning to you.
Good morning. And we have asked for something like a circuit breaker for not just the Liverpool City region, but across the country, because I believe that whilst we're having these additional restrictions imposed on us, even they may not have the desired effect. And what you need is this, jolt to what's happening with coronavirus to really reset the dials and hopefully see those exponential increases that we've seen in transmission rates start to decline.
At what stage do you think you start to call for a circuit breaker now?
No, we've already done that, in all honesty. In fact, 3 weeks ago, the Mayor of Liverpool...
A couple of weeks ago, you said it wasn't one of the options.
Sorry?
A couple of weeks ago, you said it wasn't one of the options that you were looking at, a circuit breaker.
No, I said it wasn't the option that had been offered to us by government at that stage. But we didn't know, of course, at that stage, we're asking for a circuit breaker because it wasn't something that the Chief Medical Officer even discussed with us. So that's what I reported. So it wasn't an option because it wasn't on the table. Subsequently, two of our leaders asked for a circuit breaker. So they've already put on record that they thought it didn't go far enough. And what we've done is to have discussions with government, who then decided that the Liverpool City region would have Tier 3 imposed on it.
Mm-hmm. You've got some more money that has come into the region as a result of your discussions with government. I think it's about 30 million quid, isn't that right? That could help to go to support some of the businesses. Would you have got that without the back and forth that you've had with government over the past few days and weeks?
Well, no, we wouldn't have, but those negotiations were predicated on a number of things. One, the suite that we were given, so the prescriptive list, as we thought, for Tier 3 areas, that was a discussion point. And the government, by that stage, by the way, the legislation hadn't gone through government, so we had nothing to actually look at in law. But we were told that they were the level 3 restrictions, and that included things that haven't been included, such as gyms in other areas. In Lancashire, they've had things that aren't imposed on us, so there's a confusion around that. There was a request for the scientific evidence that supported the restrictions, and then, of course, there was a need for an exit strategy. How can we measure our progress so that we can see how quickly we can come out of Tier 3 and back into Tier 2?
Let me ask you about how we manage this then, just finally, with the news that the test and trace info is being given to the police, or some of it is being given to the police in order, presumably, to try and help them manage people's compliance with this. Do you welcome that in Liverpool? Is that going to help you come out of Tier 3 earlier, do you think, if people can be shown by the police to be somewhere that they shouldn't be?
Well, what will help us come out more quickly is what we've already wrestled from national governments, which is local control over test and trace. And we can do things here far more efficiently and far more quickly than government could. And why do I say that? Because we can evidence it. There was a place called Prince's Park in Liverpool. Liverpool City Council did things very, very differently and demonstrably brought down coronavirus transmission.
So you don't need the police involved?
Well, the problem is that we have to be careful about deterring people from actually taking those tests in case it's seen as being Big Brother. So I'd say a note of caution to government. Let's take people with us and explain the messages so that they don't feel as if that this is being done to them yet again.
Just very, very finally, your name has been mentioned multiple times over the last few days by the Prime Minister. Look at you rolling your eyes. He's name-checked you at almost every moment. Are you happy to be so clearly close to the Prime Minister's position on this and so heavily referenced? It must be great for you.
No, it's not. And the wife's getting jealous, so I wish it'd stop. If I had £1 for every time that I've had my name inappropriately used, I'd be challenging Captain Tom for his exploits in charity fundraising.
Why inappropriately?
Well, because what is actually happening is it's an attempt to divide and conquer. So by using me, it looks like, oh, well, they've done something. Why aren't other people doing the same sort of thing? And I know what it's about. It is about trying to see whether they can prize myself and Andy Burnham apart. But let me tell you, there's no chance of that happening. Myself and Andy Burnham will stand shoulder to shoulder. What he's doing for Greater Manchester is the right thing for them. What we're doing here is the right thing for the Liverpool City region and the 1.6 million people that I represent.
Steve, good to talk to you. Thank you for your time on the programme this morning. Steve Rotherham, Metro Mayor of the Liverpool City region. Wales, then, it would seem, from a leaked letter, heading towards a circuit breaker over the course of the next week or so. We'll get a decision on Monday, but the decision is being discussed, we understand, today. If you live in Wales, is that the thing that you need to get control of this virus? Again, on average, your cases per 100,000 are way, way down. The idea of pubs, restaurants, cafes, bars closing for 17 days, possibly schools for 2 weeks, it's overkill, isn't it? It's unnecessary. 0345 6060 973 is the number. Interested too in the police involvement in test and trace. Do you think Steve Rotherham is right that it is going to be a sort of Big Brother style intervention that's going to put people off? Come to more of your calls in a few moments' time. It's Swarbrick on Sunday here, 10:19.
This is LBC. Swarbrick on Sunday with Tom Swarbrick, live from Westminster on LBC.
Morning to you, 10:22 is the time. Tom Swarbrick here on LBC. Hope we find you very well this morning. Wales apparently considering a circuit breaker, 17 days of closed pubs, restaurants, bars, cafes, schools, potentially involved as well in a shutdown that would see the Welsh authorities get back control of the viral spread, but a viral spread that is, by comparison to other parts of the United Kingdom, certainly in England, Liverpool and Manchester and parts of the northwest, is way, way, way lower. And I just can't understand why we are repeating some of the blanket, broad brush, hammer down approaches of March, when in October we have got a test and trace system that is by no means working anywhere close to where people would like, but nevertheless is uncovering some of the spread of the virus. We know the regions where the virus is spreading in greater numbers. So why are we resorting to a tactic that once we're in, it's very hard to get out of? They say 17 days, or it's reported that the Welsh Government is thinking about 17 days. Well, what if the case numbers aren't down after 17 days? What if the R number's not down after 17 days? Do we come out of it anyway? Or do we stay in it until the numbers come down? In which case, why can you and how can you put a time limit on it? 0345 6060 973. Let's get to Craig, who's in Bridgend this morning. Hi there, Craig.
Hi there. How are you? Hope you're all right.
I'm very well, sir. Yeah. Do you think this circuit breaker is the right thing for you and your fellow countrymen?
Completely. I think it's absolutely the right thing that we should be doing. I know you mentioned just now, obviously, that we've got lower rates than the rest of the UK, but we're following scientific advice, which is something the government has claimed to constantly been following. Clearly, they're not. And yeah, I think it's the right approach. Really?
But why? Why are we going for this blanket approach when parts of you'll know better than I do, Craig, but Cardiff and some parts of Wales, the case numbers are rising far more than they are in some of the more rural locations. Are we really suggesting that we shut down the local village pub of an area where there are no cases of coronavirus or very, very few because Cardiff's got tons?
That's not necessarily true, though, because you've also got rising cases across the north, which is far more rural. It's not just South Wales. This is an issue across Wales. And obviously, I'd say this is a more proactive approach. So if we were in a situation where in 3 weeks' time the R rate's still going up, infections are doubling across the country, what do we do then? If that continues, we're eventually going to end up in a national lockdown anyway. So I consider this a proactive effort rather than a reactive effort, and I think it's an inevitability that actually...
Just a word on schools, Craig. You think schools should close as well, perhaps for a couple of weeks?
Yeah, well, I mean, back in, when was it? Yeah, end of August, beginning of September, we had Boris Johnson saying that schools were COVID secure. Clearly, that's not the case because, I know from a number of schools just in Bridgend, we've had entire year groups taken out because children are infected. They're then going home and then they're infecting their parents, so their parents can't then work.
Craig, listen, I appreciate the call and I appreciate the point about schools. I just think, please no, you can't shut the schools again for an indefinite period of time. Thank you for the call. Come to more of your calls in just a few moments. Let's turn to Professor Sir David Spiegelhalter, statistician and chair of the Winton Centre for Risk and Evidence Communication at the University of Cambridge. I wonder, Professor, whether the statistics show that a circuit breaker is required.
That's extremely difficult. I don't have a strong opinion as to what should be done at the moment. We're at an extremely tricky, delicately balanced time, I think. If you look at the statistics, you can see that hospitalizations and deaths are going up, much slower than March, roughly doubling around every 2 weeks. Infections have had a period of rapid growth, but to be honest, they do seem to be levelling off rather. And some of the high-risk northern areas, there's even some evidence that they're going down. The current measures, which are fairly rigorous, do appear to be starting to work in those areas. So, as I said, it's extremely delicate. I can see the argument for a circuit breaker. Sage, back in the end of September, were very strong on this, that this was, a short-term, vigorous action to both reduce the magic R number below 1 temporarily, only for a short time, and crucial to reduce the number of people who actually have the disease. And that's what is the prevalence, how many people are passing it on, with the idea not of eliminating it, essentially we have acknowledged, I think we're going to have to live with this over the winter, or certainly until a vaccine comes along, but it's keeping a lid on it. It's buying time. People have said, it's just kicking the can down the road, but actually that's what we want to do. We want to buy time. We want to make sure that hospitals are not, subject to this enormous...
Yes, but it's buy time until when, I guess? Buy time, because you talk about a vaccine, but we don't know when a vaccine is. If we move from, summer gentle opening to winter harsher lockdown, we could do that for years.
Oh, well, I have no special insight into whether a vaccine will come along.
No, but in theory, we could do that for the years. If the idea is, sorry to interrupt, David, but if the idea is to keep as you say, very sensible idea, let's keep the lid on it by expanding and then contracting on what it is people can actually do and the number of people who have this thing. Until a virus comes along, who knows how that's going to be, we could live like this for years, couldn't we?
I think we've got to get used to the fact that there very well will be long-term changes to our society, because when the vaccine comes along, and not everyone's going to get it, I'm sure, it'll only be maybe the top half high-risk group, half the population is going to come along. This virus is going to be with us for a long time. We're going to have to learn to live with it in some way or another. But I think the idea of a circuit breaker, I'm not saying whether it should happen or not.
Okay.
It's put us back, it's been suggested if we had 2-week circuit break, it'd put us back where we were maybe 4 weeks ago or even earlier if things worked very well. But that it might have to happen again. At regular periods.
Sure.
We go right back in March when Imperial College released their very highly influential paper on which is argued led to the initial lockdown. They specifically had envisaged the idea that this would happen as a sort of sawtooth activity for some period of time to come.
But does it mean, why have, as I think it seems that Wales is doing, having a 17-day circuit breaker that is apparently coming in from next Friday, why time limit it like that if the aim is to reduce the number of cases? Why not say that we will continue to have this circuit breaker until R reaches this level or until the number of cases reaches this level? Why do it by time if it doesn't meet your ends?
As I said, I don't have any special insight. My guess is that the advantage of a time circuit breaker is that people can plan for it. Is that you can just say, so this is the period when we're going to be off.
But if it doesn't work,
well, that's another issue. But I think that the specific timing does seem to have a big advantage in terms of people being able to make their arrangements about work, about childcare, even about holidays. People want to still have holidays, but they're not going to be able to during this period.
So you're content that even if a circuit breaker is implemented, say, for 2 weeks, by the end of the 2 weeks, the R rate is as high, maybe higher, the case numbers are still growing, for whatever reason, you're content that actually that's enough, people would have had enough by the end of 2 weeks, we come out of the circuit break even with cases high.
I'm not content with anything, unfortunately. Any authority whatsoever. But Sage in there, they listed all the possible things we could do, from total lockdown. This is in September. The most effective, the least effective, wearing masks outdoors. Completely pointless as far as they can see. And a circuit breaker. They with reasonable confidence thought that circuit breaker would bring temporarily R down below 1. That it would work if it was effective as has happened before. We know we can do it. It's happened before. So I again, not my job, but I would imagine that given the fact that the measures so far do seem to be having an effect in the north, that a 2-week circuit breaker would be effective. But it's not the end of the story in any way.
I just wonder if it's necessary, if cases are coming down, as you say, in those parts of the country. Is this talk about a circuit breaker even needed, really, if cases are coming down now?
That is not my experience. I would not wish to make a judgment on that at all. That, I think, is the...
But the stats perhaps back that up.
This is the science. I'm not an epidemic modeler. I'm not going to make any claim on that. But one can understand why this is such a difficult decision, and there is such a contested belief about what should happen now. And in a way, this is inevitable because there is a lot of uncertainty. There's so much uncertainty about how much virus is circulating, the chance of reinfection, how many people have some natural immunity, and so on. There is so much uncertainty going on. The one certainty we do have, I think, is in counting some statistics, and that's why we should need to pay real attention to what's going on.
Very, very finally, you are looking into what went wrong with the algorithm that was imposed on people in order to decide their GCSEs and A-levels. What can you tell us about what you've discovered about that algorithm so far?
I can't tell you anything at all. But I
tried.
Exactly, you can have a try. I am on the panel set up by the UK Statistics Authority to look at the algorithm. But I can say...
Is it a monster? Is it an absolute monster, as the Prime Minister described it? A mutant algorithm?
Our job is, yeah, exactly. But we have said our job is not to forensically pull apart exactly what they might have done wrong or what could have been done better at the time. Our job, I think, is much more important than that, which is to start to make some opinions about possibly the future use of algorithms in a public role.
More algorithms, possibly. Professor, thank you. Professor Sir David Spiegelhalter, statistician and chair of the Winton Centre for Risk and Evidence Communication at the University of Cambridge. As Archie's texts on 84850, Tom, we'll be doing this till next autumn. Well, there's a thought. 0345 6060 973. We'll run you through the front pages of the papers. We'll also speak to the owner of GAY about the legal challenge that they have launched against the government's 10 p.m. curfew. Tom Swarbrick here, Swarbrick on Sunday. Let's get some news headlines now. Bill Overton.
The Cabinet Office Minister Michael Gove's ruled out a national circuit breaker lockdown for England. Labour backs the idea as a chance to reset provisions like laboratory capacity for COVID testing. Wales is expected to adopt the approach. A former Health Secretary, Lord Lansley's told this programme constantly changing rules only adds to confusion. The Mayor of Greater Manchester has criticised the Chancellor's judgment as he opposes tougher restrictions for the area. Andy Burnham wants more financial support for his region if it has to move into Tier 3 restrictions. Liverpool, already in the strictest lockdown, is getting an extra £30 million of government cash. Police are going to be able to access details of people who are told to self-isolate by the NHS Test and Trace service. It's prompted complaints. It could undermine confidence in using the app. The weather, early mist and fog patches, then mostly cloudy again with a few sunny spells today. More drizzly for parts of northern England, Wales and Scotland, with a high of 15 degrees.
LBC This is LBC, Swarbrick on Sunday, with Tom Swarbrick, live from Westminster.
Very good morning to you. We'll talk about schools after the news at 11 o'clock. We'll speak to Kate Green, the Shadow Secretary of State for Education, Labour MP. We'll talk about whether the schools union, the teachers union, is right to say that schools should close for 2 weeks over half term in order to act as a way of stopping transmission. Talk about that after the news at 11. Ian, you're going to be next on the radio to discuss whether or not you think a circuit breaker is right for now, and certainly, and more specifically, for Wales over the course of the next 17 days. But let's run through the front pages of the Sunday papers for you this morning. The Sunday Telegraph to kick us off. Blair accused of breaking quarantine rules with US trip. Tony Blair last night accused of a flagrant breach of restrictions after failing to self-isolate for a fortnight following a 2-day trip to the US on a private jet. His office, I think, are claiming some form of diplomatic immunity on that. Sunday Mirror, royal exclusive. Queen's pardon for hero killer of London Bridge. The murderer who saved lives by foiling terror attack is to be let out early, the paper reports. Onto the Observer, 1 million young Britons face jobs crisis within weeks. Study highlighting the risk to COVID generation. Their picture is a picture of Jacinda Ardern, the New Zealand Prime Minister, winning a landslide second term in the elections over there. Of course, her COVID response has been, judging by ours, pretty tremendous. On lbc.co.uk, police forces across England have been granted access to people's data who have been told to self-isolate through the test and traced scheme, presumably as a way of trying to enforce it. Again, I wonder if that's an infringement of your privacy, or given that infringements of privacy are happening so regularly now, whether you just welcome it. Sunday Express, virus circuit breakers would not end. Fears grow that they will trigger an indefinite series of costly lockdowns. Well, I have to say, to an extent, I agree, on the basis that how do we get out of these things if the weekly or the fortnightly circuit breaker that's being called for doesn't result in case numbers coming down? Well, what then? You just presumably have to carry it on. Sunday People, perfect winter storm. The NHS facing a perfect storm of frontline shortages and lack of tests for coronavirus this winter. We'll get into that after the news at 12. Sunday Times, Gulf Minister of Tolerance in sex assault claim at Books Festival. This is an allegation of sexual assault regarding the Hay Festival that took place in Abu Dhabi. Claim made by a British woman who alleges she was the victim of a serious sexual assault by a senior Emirati royal while working at the launch of that. Claims in the paper. Mail on Sunday. Official MPs did flout 10 p.m. bar curfew, but Matt Hancock refuses 30 times to say if he was among them. We'll talk about that curfew and the legal challenge to it in just a few moments. Let's come to your calls first, though. Here's Ian in Huntingdon waiting patiently to come on the radio this morning. Hi there, Ian.
Hello there.
Hello, sir.
I think the original lockdown, I think we all got the idea of that, right? The idea was that you flatten the curve and give the NHS a chance to build sufficient capacity and protocols for treating this disease. And I think everybody bought into that and went, yep, that's fine, okay, we'll play. And now they've got to the point where they actually don't know why they're doing this anymore. I think the NHS has built the capacity. We've now got the Nightingale hospitals that are all sitting there empty. The NHS has got much better at treating this disease. Far fewer people as a percentage are dying of it. I think I read the other day that the average age of death from COVID-19 is now a couple of years higher than the average age of death from everything else. So, while I've lost two friends to this. It's not. I'm not trivialising the disease.
Yeah, no, I agree. And it was interesting to hear Professor Spiegelhalter talk about, actually, there's evidence that in some parts of the country that have had these stringent restrictions, case numbers are coming down. That's great.
Right. But the point is about flattening the curve, and is that when you push down on the curve, what's underneath it has to go somewhere. So you just make it longer. So the reason that we've got a second wave is because we were so good at suppressing the first one. And if we suppress this second wave, we'll have a third. And if we suppress that, we'll have a fourth. So by flattening the curve, the area under the curve must remain the same, because it's a virus. And until we have a vaccine, roughly the same number of people are going to get it, whether we like it or not.
I agree, although the way in which hopefully we would manage the pop-ups of the virus again is through a test and trace system that's able to isolate and remove people from society if they have got it or if they've come into contact with it. Great call. Thank you for it. 0345 6060 973 is my number. Let's talk about that 10 p.m. curfew. Jeremy Joseph joins us. He's the owner of GAY Limited, which runs 4 entertainment venues across London and Manchester, is in our studio this morning. Thank you for coming in. We'll play you some footage in just a moment of what was happening in Soho on Friday night, but tell us why you are legally challenging the 10 p.m. curfew.
Because I think first things first, it's really important to say is that hospitality wants people to be safe. Everything we've done has followed government guidelines, whether it be making people wear masks when they come into the venues. We've done track and trace before the government even brought it in. We did track and trace with photo ID, which a lot of venues didn't do. We walk people to their tables with their masks on. We do everything to keep our customers safe. We've got screens in between every table. I believe our venues are safe.
Sure.
So we are being asked to keep everybody safe inside our venues, but at 10 o'clock on the dot, kicking everybody out onto the street. So from being socially distanced and safe inside a venue, we're now being asked to make them unsafe outside.
Well, we've got a prime example of that from Friday night. I mean, you will have seen it, I'm sure, too, Jeremy. But have a look at what was going on pretty much just outside GAY in central London in Soho.
I need to stop you on that, because those photos are actually not realistically, because I was there and I was watching it. That's false reporting.
Do you think?
Yeah, I know. So
well, those are images that were taking place.
Let me tell you this. What really happened? There was a lot of police presence on Old Com Street at about 8:45, and the police came and spoke to me. And what you're seeing photos there is actually a planned demonstrations, not a party. So if you actually look at some of the photos from where GAY was, we had to put barriers out to direct customers away from it. That was a complete planned demonstration. There were arrests.
This is it. This is what it looked like. I guess this is the.
But that's a protest. Not people coming out of bars and clubs. And that is saying that was after hour partying. That was trying to compare it with what was going on in Liverpool a few days earlier. That wasn't. That was a demonstration.
You're still seeing people flooding down to the tube. You're still seeing people crammed into the.
But that's a separate thing.
Sure, but you're still, as you say, the curfew is. You could have had a gradual sort of exit time for people.
So what we really want is we want the government to talk to hospitality and work with us. There are so many things that could be put in place to make this safe. For example, you could have drinking up time, bring that back. A curfew is a strict 10 o'clock get out. Whereas before, with, say, for example, GAY Bar, we had a 12 o'clock licence, but we had a 20-minute drinking up time. So GAY Bar is 3 floors. It's a basement, it's an upstairs, it's a first floor. And we would close the basement at 12:10, upstairs 15:15, and the ground floor at 20:00. Giving people 20 minutes to drink. It's staggered. You could also have staggered closing. So, a pub that shuts at 11 could close at 10, a bar that shuts at 12 closes at 11. So not everybody is going on the street at the same time.
But and where this gets it legal for you is what the evidential basis for bringing in the curfew of that.
So the process of this legal action is we got lawyers to write to Matt Hancock and ask for the evidence of the 10 p.m. curfew. They replied and said, we need another 2 weeks. We replied and said, hang on a second, if you brought this curfew in, why do you need 2 more weeks? You should have the evidence at hand because you brought it in. Surely when you brought it in, you have the evidence there. So we then gave them another 2 days. They again said we need another 2 weeks. So then we put the proceedings in, and a judge has given them till next Wednesday, which again we are against that. We think they've given too much time to come up with the evidence. As you've seen in Germany, they've already taken back the 10 p.m. curfew.
Just finally, London has gone into Tier 2 now.
Yeah.
What financial support is available to you as you see, presumably, correct me if I'm wrong, you see trade drop off even further?
We have no financial support whatsoever, and it's the whole plans that are being offered at the moment, we're not sure whether we're entitled to it, because some of it for the staff could be only if we close.
Yeah. But you're not closed?
We're not closed. We're under... I mean, I've got 3 venues in London, 1 in Manchester open at the moment, and we're losing money. We're probably losing about £2,000 to £3,000 a day at the moment, and we didn't apply. Annoyingly, we didn't apply for any grants, and the reason was we didn't think we'd be entitled at the time because we had reopened. We were kind of covering most of our costs, so we thought we're not entitled to it. We thought we were going to get through this, and then obviously the grant application stopped and the 10 p.m. curfew came in, and suddenly from actually getting everyone back to work, we've gone from that to going, what are we going to do? And now we're not entitled.
So do you think you will survive this?
I can't answer that at the moment because we're on a daily basis trying to work things out. I mean, we've got to work out what we're going to do.
The fact that you can't answer that, I just wonder how that makes you feel as the owner of this, as an iconic venue in central London, to think that you're not going to be there. Because of
we have to be there. I mean, you've got to look at, for example, Heaven. It's been an LGBT venue for 40 years. We have a duty to keep it open. I don't know what we're going to do, but we have to find a way of keeping things going. We employ 160 people. Sorry?
What would you say to Sadiq Khan?
I'd say, Sadiq Khan's a different kettle of fish at the moment. He changes every day of what he thinks. I mean, he started off by believing in the 10 p.m. curfew. He fought for the 10 p.m. curfew, and then he started going, I want a review of the 10 p.m. curfew. He keeps changing he wants. Ideally I wouldn't be against a complete lockdown if at the end of that lockdown we knew where we were going to go. But the worst case scenario, if we go into the 2-week break or whatever, we're going to come out into this bad situation, which is the current curfew. It's a no-win situation for anyone at the moment.
Great to see you. I'm sorry that times are so tough. Jeremy Joseph, owner of GAY, running 4 entertainment venues across London, and as you heard, in Manchester as well. Incredibly difficult time for the pub, bar and nightclub trade. I'll come to more of your thoughts in a few moments' time. We'll speak to Labour's Shadow Education Secretary in a moment too. Tom Swarbrick here, 10:49.
Nick Ferrari at breakfast, LBC.
Former Conservative Party leader, Cabinet Minister, Sir Ian Duncan-Smith. I imagine, Sir Ian, you're not best pleased with the news that will affect the good folk of Redbridge where you are.
No, I'm not actually. The figures vary dramatically from one end of London to the next, but the average is still very low relative to so many of the other towns. And I was pretty annoyed because the mayor, we're listening to him when most of London simply doesn't want to be locked down as if it's one single area. It's a very complex city, and I think this is a mistake.
Nick Ferrari at breakfast, weekday mornings from 7, LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Text 84850.
Morning to you, 10:54 is the time. Vicky in Leeds, you're going to be next on the radio to talk about this situation regarding hospitality, but I want to talk about schools for a moment. Kate Green joins us. She's Shadow Secretary of State for Education and Labour MP for Stretford and Urmston. Thank you for coming on the programme this morning, Kate Green. Good to speak with you. Just asking about, first of all, this circuit breaker idea in Wales. Presumably you think that's a good idea?
Yes, absolutely. And it's what Keir Starmer called for earlier this week across the whole country, because the situation's becoming really desperate now, especially desperate, for example, in Greater Manchester, where I am. But we can see rising infection rates all over the country. And it's very clear that the government was advised nearly a month ago by its own scientists that the circuit breaker would buy time to start to bring down the infection rate and put in place measures like local tracing of people who've become infected or in touch with people who've been infected. And it just seems to us now that we've got to take this action. The price of not acting is going to be utterly desperate this winter.
Why can't Wales perform a circuit breaker or Greater Manchester perform a circuit breaker? Why does Cornwall or North Norfolk have to do similar?
Well, because although places like Greater Manchester, obviously we have a very high rate of infection, and it is really frightening here, we can see a rise in the infection rate right across the country. And you know, where we are today, other parts of the country may just be coming along a little behind. And it's very clear.
Heck of a thing, though, to try and have to persuade those businesses, those individuals again, that for 2 weeks everything is going to be shut when life is as normal as it's going to get right now.
Well, it's not very normal, is it, really, for any...
Well, no, it's not ideal, but here we are. And actually, the whatever's happening in Manchester, whatever's going on to keep the infections up, is not happening in other parts of the country. Why should businesses take the hit of another lockdown?
Well, I'm sure people don't want to find themselves in a few weeks' time heading in the same direction as we're experiencing in some very high infection rates, and early action to prevent that is better. What I would say, and this is really important for us, Tom, now in Manchester, is that we can't just bring in measures that shut down the economy, even for a limited period, without making sure there's a package of financial support for families and for businesses too. And that's what we're really waiting for the government to agree to here in Greater Manchester, so that we can, if necessary, impose more stringent local restrictions. But I would prefer a national circuit breaker. I think that will be more effective.
Does Labour believe schools should have 2 weeks off over half-term to act as a kind of circuit breaker?
Well, I think that this would be really good timing to do the circuit breaker, because schools will be closing for half-term, as you say, so the disruption to children's education would be minimised.
So let's extend that by a week, that half-term, extend it to a fortnight?
That's certainly, I think, worth considering. But our general position on children is that they should be in school during the school terms, because the downside for children of not being in class, in terms of their learning, obviously, but also their social and emotional well-being, is so significant that there's a real wider public health and mental health issue about making sure children are in school and learning in the classroom.
So the idea then of the union saying, hang on, let's give us 2 weeks here, let's have a 2 week half term. 1 week normal half term, understandable perhaps, but a second week perhaps isn't necessary in your view because of those considerations around mental health and well-being.
I would prefer children to be back in class after their normal half-term break. I think it is so important for their emotional well-being, for their mental health and for their learning.
What do you understand to be the impact on the infection rates of schools being open? How much are children going to school contributing to the spread?
Well, I think that's a very difficult question to answer. Thankfully, children themselves seem to be less prone to the worst effects of the virus. But that's not to say that interactions at the school gate, for example, where parents are dropping off their kids, or, you know, the fact that staff and pupils are going to and from home and out and about in the community doesn't mean that there will be some spread of infection. Schools, though, have taken many measures to limit the risk of infection. What they're not getting, of course, is the proper help that they need from a proper national testing and tracing system, which would really enable much better control of it.
I'd love to ask you about that. Sadly, we're going to run out of time. Very, very finally, why does Labour suggest a 2 week circuit breaker is enough? If it's the end at the end of 2 weeks and the case numbers are still rising, would you carry the circuit breaker on?
Well, 2 to 3 weeks, but we're following the advice of the sage scientists in suggesting that sort of period. But it won't be enough just to have a break. We have to use that time profitably.
But the worry is it just extends. You've got 4 weeks happening in Northern Ireland now. And you can't. I don't think you could do it just on time, can you? You have to. The job is to get the virus down. If the virus is not down after 2 or 3 weeks, then presumably Labour's position has to be that you would carry it on.
Well, it's really important we take measures during the circuit break that do bring the rate down. You're absolutely right to stress that. But I think the difference is that with a national circuit break, the scientific advice is that is a real opportunity to break into this rise in the spread. What we're seeing, meantime, with the local restrictions that we've had, for example, in Greater Manchester since the end of July, is that those are not working. And that's why we think now it is essential to move to the national circuit breaker.
Kate Green, many thanks indeed for your time again on the programme. Shadow Secretary of State for Education, Labour MP for Stretford and Urmston. I want to carry on that theme after the news at 11 o'clock, talking about the impact of schools on the spread of the coronavirus, the unions, the teaching union, the NEU, largest one, calling for a 2-week school holiday in order to try and drive down the virus. It's what's being thought of in Wales to coincide with this circuit breaker. If you teach, if you've got kids that are going into school of varying ages, all kinds of ages, I think my 5-year-old school is doing a fantastic job in managing the spread. Fortunately, we haven't had an issue with him going back to school. Is there really a massive problem with schools that mean they ought to close for an extra week after half term? Come to your thoughts on that as well. We'll talk space in the next hour too. The fact that the PPE could start to be being delivered by drones. You heard it here first.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 11 o'clock, the mayor of the city, currently under England's tightest coronavirus restrictions, is warning the government not to undermine test and trace. It's allowing police to access personal details of anyone who's told to self-isolate by the NHS system. A potential £10,000 fine faces those that don't. The Metro Mayor for the Liverpool City region, Steve Rotherham, has told Swarbrick on Sunday public confidence in the app is essential.
We have to be careful about deterring people from actually taking those tests in case it's seen as being Big Brother. So I'd say a note of caution to government. Let's take people with us and explain the messages.
Liverpool's being allocated an extra £30 million of government funding to help businesses affected. Greater Manchester's Mayor Andy Burnham continues to oppose tougher restrictions there unless there's more financial support. It's claimed a so-called circuit break lockdown for Wales will be confirmed tomorrow. The government there insists no final decision has been made. A letter leaked from the CPT Transport Union suggests pubs, restaurants and hairdressers will be asked to close. On this programme, the former Health Secretary Lord Lansley has said even for Wales, it's an odd decision.
For example, I have relatives in Ismon and Anglesey. The rate is not high there. It's quite different from what it is about 30 miles away in Conway. And it doesn't make sense necessarily to have the same restrictions in those two places.
A leading UK scientist believes more than one vaccine for COVID-19 will be available in the first quarter of next year. Sir Jeremy Farrar sits on the government's SAGE Scientific Advisory Committee. He also backs the idea of acting to limit the spread of infection UK-wide.
When you go earlier, the restrictions can be less draconian and you can have a bigger impact on transmission and critically get that R value down to 1 and below 1. That's what we've got to aim for. That's got to be the objective.
Tens of thousands of businesses and millions of workers favour a quick trade deal before the UK leaves the European Union. The Confederation of British Industry and more than 70 separate trade associations says it's best for the sake of jobs and livelihoods. They feel an agreement would turbocharge business preparations for Brexit and increase confidence in the UK as a place for investment. The Transport Secretary has criticised councils for allowing traffic jams to build up where newly created cycle lanes are not being used. The Sunday Telegraph reports a letter's been sent from Grant Shapps warning local authorities he won't tolerate ill-conceived road closures. A £250 million emergency fund was announced by the government in May, encouraging councils to create wider pavements. The weather, some early mist and fog patches, then mostly cloudy today, with a few sunny spells, more drizzly over parts of the north of England, Wales and Scotland. A high of 15 degrees. From Global's newsroom, I'm Bill Overton.
This is is LBC from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good morning to you. Just gone 11 o'clock. You're listening to Swarbrick on Sunday here on LBC. I'm Tom Swarbrick. Good to have you with us this morning. Coming up over the course of the next 60 minutes, I want to talk about space, or rather how space is coming to you in the form of drones that are going to be used via the UK Space Agency to carry PPE between hospitals. The Space Agency has approved funding for this scheme. It's going to obviously cut the time that it takes to deliver this stuff if it's going by road or rail. If you can just fly it over, that makes it a lot easier. We'll talk about that a bit later on in the programme. We'll talk to Greene King as well. Chief Executive is going to join us about the impact of all of this on the pub trade. And after 12, I want to talk specifically about the NHS. Front page of the Sunday People this morning. The NHS facing a perfect storm of frontline shortages, a lack of testing, and a problem of getting the flu jab to people as well. We'll talk about the impact on the NHS, how it's coping with all of this, after the news at 12. To schools first, where teaching unions have called for an urgent circuit breaker over October half-term, which would see secondary schools and colleges close for 2 weeks in England. This is the National Education Union, it's Britain's largest teachers' union, has said the move could help the government get in control of the test, track and trace system and get cases lower to allow the system to work better. Has your school been savaged by coronavirus? Have you been off and on again throughout the course of the last few weeks with the kids coming home feeling very unwell and you've been told to self-isolate? The year group has been told to isolate because it's in a bubble. Has it been a bit of a mare going back because of the way in which coronavirus is spreading through the school, and your child or you as a teacher does not feel safe there? Would a 2-week circuit breaker of schools, 1 week being off over half term, so an extra week off, would that be the thing to help gain more control of coronavirus spreads, particularly in schools? 0345 6060 973. We'll speak to the union in just a moment. First, Anne Longfield is Children's Commissioner for England. Thank you for coming on the programme this morning, Anne. I wanted to ask you about whether you felt that it was a necessary thing to do to get the schools closed for just a bit longer in order to get more control of the virus. Morning to you.
Morning. No, I don't think it's necessary. And actually, for some children, I think it could be catastrophic. I've argued for a long time that schools should be the first to open and the last to close, and I think that still stands. And I'm really pleased that all the political parties are in agreement with this. Kids are just back into their routine. They're just getting back on their feet, just starting to get their confidence back. And I think to disrupt that now would have a huge and serious impact on their well-being and mental health. It would really hamper all the efforts that are going on to try to identify which kids need extra help and keep them safe. And I think it just further, increase that divide in education between the poor kids and those that have had much more advantages during this time. So at this stage, I think no.
We've just had the Shadow Secretary of State for Education on, Kate Green, talking about the idea that Labour would consider it as a possibility to extend the circuit breaker to schools for an additional week after half-term. Do you wonder whether the political consensus that has been there about schools is starting to fracture a bit?
Well, I don't think it is. I mean, obviously, you wouldn't want to rule out anything at any point, and it's really important that at some point schools might have to close. But again, what the scientists say is that actually schools are managing the safety very, very well. I've been so impressed by what teachers have done in their schools. And actually, with Public Health England's advice locally, they're being very, very cautious. So actually, the scientists say that what's already in place is mitigating many of the things which a lockdown might need. But if schools are closing and do have to close at any point, there does need to be, the tech in place. There does need to be the test and trace in place, and indeed the access to some kind of consistent learning for all children. So at some point, it will have to happen for some children, already is, as we know. That's actually what needs to be part of the ecosystem to be able to support those children.
Anne Longfield, hang on the line for us a moment because I want to bring you back in. We're joined by Amanda Martin as well, Executive Member, former President of the National Education Union, who have been calling for this. Amanda, thank you for being there for us this morning. What is the scientific evidence to suggest that a coronavirus outbreak is happening because of schools being back?
Okay, so firstly, I do agree with Anne, and so do the union, that kids need to be in school. We were the ones who all along said that our schools and colleges need to remain open. But what's happened is there are kids that aren't in school. So figures of attendance have dropped from 95 to 90%. 18% of secondary schools have some kind of partial closure because of coronavirus. And the scientists, the national statistics have shown that the virus has trebled in secondary age pupils between the 23rd of September and the 8th of October. It's trebled. It's the largest group outside of university students.
Yes, but that's 18 to 25-year-olds, I think, isn't it? So we're talking about the top end of school leavers. And actually, even in the numbers that the scientists were talking about, they were suggesting that actually schools and universities seem to be lumped together in some of the test and trace data.
No. The Office of National Statistics have broken it down, and you've got secondary pupils, so up to the age of 11 to 15 or 16, and then you've got 16 to 24 age group. So both of those groups have seen a rise in number, but particularly in the secondary school age, it has trebled. And I guess our concern with that is when you can isolate at university, you can isolate in your halls, but when you're in secondary schools and you've got the virus, you're going home and you're in your communities much more.
If someone's got the virus, they shouldn't be in school, though.
No, they shouldn't, but we have to also realise that kids are often asymptomatic, and when it is found that a pupil has the virus, they are then isolating at home, but obviously they're bringing it back into their home environment and into the community much more. And so what we've seen is we're having bubbles closing, and because of our classes are so large in this country and our classrooms are so small, that means that those bubbles that are being sent home are entirely whole year groups.
The suggestion, though, that it is the asymptomatic children who are spreading it into the community is not something that the scientists agree on. In fact, they've already said that the probability of school outbreaks is related to the incidence in the general community. Consequently, it is difficult to extrapolate from a study undertaken at a time where most school children were not in school, and those that were mainly on under 11-year-olds. So actually, it would seem that the community transmission is happening and going into schools rather than schools being the source of community transmission.
In the primary sector, yes, because they're under 11s, but secondary schools have 11-year-old up and above. There has been a treble in the number of kids with the virus.
So is your suggestion to shut secondary schools for 2 weeks?
We think that if there is the call for the freeze, then we actually believe that, yes, secondary schools and colleges need to be included in that.
But primary schools not?
No.
OK. Let's bring Anne back in. Anne Longfield, Children's Commissioner for England. Does that waylay some of your concerns, Anne, if it is a much more targeted approach by saying just secondary schools?
Well, obviously, I'm really pleased that primary schools aren't part of this proposal. But I would still say with secondary schools that the numbers are changing every week, but they're actually changing very slowly in terms of the numbers of schools that are fully open. Near on 9 out of 10 of schools are still fully open and operating. And even in the areas of high infection, which I'm obviously really worried about as well. We're all worried about this and watching it on a daily basis. The majority of schools, 3/4 of schools are still open. And I just don't think that's the time yet to be able to really look at such a drastic measure, which would have such an impact early on. Just again, kids have had such a disruption in their lives, all of this time out of school, and it's knocked their mental health and well-being like nothing else. And for those kids that have had a really tough time during lockdown, it's only now they're starting to get the confidence back to tell anyone about it.
Amanda, is the suggestion that schools aren't safe enough, that it was never going to be safe enough to deal with the number of pupils coming back and coronavirus?
Well, I'm a teacher and I work in a school as well. And we, like every other school and college in this country, have done extraordinary amounts of work to make schools as COVID safe as possible. And I think that exactly what we've talked about, larger classes, small classrooms, no mandatory mask wearing, social distancing is very, very difficult in a school setting. So, yes, we are trying to keep it as safe as possible, but there are outbreaks or there are cases. And I think what you can see in schools, so for example, in a school where you have a single case, that bubble is sent home and no further cases, that shows that those bubbles have contained the virus, for want of a better word, and there hasn't been an outbreak. And schools are working really, really hard to do that. But actually, SAGE have said that needs to be a time to calm it down. We can embed much more rigorous tracking and test track and tracing, and they are the ones who have advised that schools should be part of this as well.
I just come back to my point that I raised with Kate Green earlier, that if the circuit breaker is instituted, if secondary schools and colleges are closed for a period of 2 weeks and the virus is not brought under control and the R rate is still above 1 and the cases are still expanding, you are looking at indefinite closure of school in the way in which we were perhaps looking at in March and April? Or is the suggestion, Amanda, that it is just an extra week on half term and then we bring them back no matter what?
Well, that's what we are suggesting, because we should be using now and that time to get test track and tracing up and learning, to get blended learning properly. We wrote to the government on the 10th of June to ask them to work with us on a recovery plan, and it included all of these things. Wales.
I understand that. And schools and the advice to schools and the way in which the algorithms were handled, it's not been a good time. But nevertheless, is it not the opposite of what you're looking for, to try and get control of the virus, to say, well, it's an extra week on half term no matter what, even if that control is not reasserted? If you're still reopening schools, and the virus is not brought down sufficiently, why bother having the circuit breaker at all?
Because there's no one answer, and you have to try other things. You have to try. The scientists have suggested it, and if they've suggested it, why are we not trying? We followed scientific advice all the way along. The New Zealand Prime Minister said you have to go hard and you have to go early. What are we going to do? Wait for it to be huge everywhere across this country, or are we going to try a circuit breaker to stop that?
Anne Longfield, just a final word from you. Jacinda Ardern has handled this particularly well, to the point where she's got a second term and a massive landslide. Go hard, go early?
Well, I mean, I think just teachers have been heroic in this, and schools, as a result, are really safe places. And I would just say here, let's hold on, keep faith. Actually, children, when they won't be in school, they're most likely to be out as well. So the safe place for them is in school.
Okay, thank you both very much. Anne Longfield, Children's Commissioner for England, and Amanda, thank you to you as well. Amanda Martin, Executive Member, former President of the National Education Union. If you are a teacher, do you feel safe enough in schools, particularly in those areas where the virus is greater than in other parts of this country? Do you feel safe enough to be there? Or is the suggestion of adding an extra week on to your half-term break that's coming up, not that it's a break? As the son of two teachers, as the husband of a teacher, I realise that you're still working over those holidays, don't get me wrong, but that an extra week would help you in making the school as safe as possible and would help in trying to drive cases of the virus down, if indeed you're finding, and are you finding, I'd be interested to hear, about more children having to go home, more classes being disrupted, kids being taken out of school willy-nilly, left, right and centre, because they're either in families that have the virus or they themselves have the virus. 0345 6060 973, or as a parent desperately trying to work from home or trying to bring in money through the door to put food on the table, the last thing you need is another possibly extended series of extended school closures. 0345 6060 973. To your calls in just a moment. Tom Swarbrick here, 11:17.
The fight against coronavirus. For the very latest, stay with LBC. This is LBC, Swarbrick on Sunday with Tom Swarbrick, live from Westminster. Call 0345 6060 973. Tweet at LBC. Text 84850.
Morning to you. Let's come to your thoughts about whether or not schools should close, as the National Education Union have suggested, for a period of a couple of weeks whilst this circuit breaker is put into place. Julie's in Suffolk this morning. Tom, children don't live in an emotional vacuum. The pandemic is putting huge stress on the parents and extended families of pupils. If a circuit breaker, i.e. extending the school holidays a little, can slow transmission, the improvement in everyone's quality of life will benefit all age groups, she says. I don't know. There's some of these poor kids who have had no access to much help over the period of time that schools were shut down completely. It's been really, really tough. Let's come to your calls. Here's Pearl in Manchester. Hi there, Pearl.
Hi, Tom. Good morning.
Hi.
Thank you for bringing me on. Yeah.
No, you're more than welcome. Tell us about schools and coronavirus for you.
I'm really odd on what's the right thing to do, Tom. I work from home, and I've been working from home since March. I'm lucky that I've got a job, and I'm grateful for that. And I live with my daughters, just the two of us. I did everything to protect ourselves. So we do our shopping online. We were not even going out. I knew that she needed to go back to school. I knew that it was very important. So she went back to school. And that's the only thing that she does. She goes to school and come home. We continue to really not associate with other people, but she caught COVID, unfortunately, at school.
Oh, no.
Her only symptoms, believe me when I tell you this, it's just that I work for the NHS, so I was able to pick up on these things very, very quickly. She said to me, barbecue sauce was tasting differently. She said she didn't like it, and I was like, what do you mean? So that evening I left her, and then in the morning I said, can you taste it again? Because I checked, it was in date, and when I tasted it was all right. And she still said that she doesn't want it. And then quickly enough, I went to go and get it tested, and it came back positive.
Oh, no.
The symptoms have already improved, so I hope she's out of the woods, but I've got a medical condition. I am really petrified of that she's already passed it on to me. Oh, I just don't know what the right thing to do. I know that her mental health and her education was important to go back to school. We cannot live this way. But at the same time, the anxiety that this is now causing, because it's like I've allowed her to go back to school and she's brought it back home to me.
Yeah, and that is the nightmare scenario that people have wanted to avoid. Pearl, you're clearly self-isolating. Have you been able to get a test?
No, I'm not showing any symptoms.
You're not what? Sorry, you're not trying anything.
I'm not showing any symptoms, so I cannot get a test.
Oh, I see.
Yeah,
I see you. I suppose in a way that's kind of good news, I guess, to start with, that you're not showing any symptoms. You don't have any signs of having caught it from her, right?
Yes. Well, we're lucky we've got a guardian and things like that. We've got a decent house, so I'm making sure that she's staying in a different room.
Yeah. And Pearl, the worry, I guess, is then what do you do in sending? Do you send your daughter back to school knowing that she's already caught it once and having to have all the concerns about her catching it and then possibly you catching it as well? Are you minded to send her back?
That's my biggest worry. I'm at odds on what I need to do, Tom. I'm really at odds on whether I'm going to let her go back after she.
How old is she, Pearl?
She's 14.
Okay. So it's quite a big school year as well. It's quite a big, period of time in her school life. Listen, I'm sorry that is the scenario that every parent has been determined to try and avoid, and I guess goes to the heart of the very, very difficult decision that a lot of parents have had to make, which is by sending your children back to school, you are knowingly putting them at a greater degree of risk. Now, the assessment that I made of it, my wife and I made of it, was that the risk of keeping them back is probably greater than the risk of certainly 5-year-olds catching it and then passing it on. But there you have a prime example in Pearl of somebody who has had that nightmare scenario happen. Pearl, I just hope you're able to get through it and you find that you avoid it. Thank you so much for your call. Here's Sally, new caller in Camden this morning. Hi there, Sally.
Oh, good morning. How are you?
I'm very well, thank you. Tell me about your school.
So I'm a secondary school teacher. We've had numerous 10-plus positive cases in the last few weeks. The rules we've been given have been changing constantly. It went from a whole year group having to isolate with a positive test to now just a few students. that the
Really?
infected people, just the students that the infected people say that they've been in contact with. In close
hang
contact
on a
with.
moment. I thought it was the whole year. I thought it was the entire bubble that had to go.
No, absolutely not. It was at the beginning. So we had the whole of year 9 off for 2 weeks. But as it has spread throughout the school, the advice to the head teacher from public health has been just pupils in close contact.
What does close contact mean in a classroom?
So it's defined as 15 minutes at less than 2 metres. So quite a long period
And do
of
you
time.
have in your classroom, Sally, I imagine your very regimented classroom down there in Camden, you have, do you have every pupil sitting at the same desk every time, so you know exactly who's where and in the geospatial arrangement between other pupils?
Within reason you can, but because especially in the old year groups when they're in kind of different subjects and mixing between classes, it's really, really hard to control that. So it doesn't seem
Do
very
you feel
safe
there?
No, not at all. Not at all. But I'm young, so I don't think that I need to worry too much. But we have had teachers who are in their 60s testing positive over the last few weeks.
Oh, that's so worrying. So if there is going to be a circuit breaker, and it looks like there's one about to happen in Wales, do you think that schools should shut as part of that?
Absolutely. I think we have really good online teaching resources available now that we're all kind of clued up on how to teach remotely. Also, no one seems to be saying that private schools have 2-week holidays all the time. You know, every half term is 2 weeks. So I hate this argument of, we can't do it, it's bad for the kids, when it seems to be okay for private school pupils.
I get you make a very good point. I guess my worry is, and I think a lot of people's worries that worry about this idea of a circuit breaker is it could be unending. You know, if the virus isn't brought under control by this thing, or not enough in control, what's to say that the school closures don't extend for another week and then another week and then 2 more weeks?
Absolutely, I completely understand that. However, I think if we don't do it now, then I would predict that schools will be closed much longer later on in the winter. I think 2 weeks now. It's 5 days of online learning is essentially what we're saying here. 5 extra days. And we can all teach online. We can deliver video lessons. It's not a problem anymore. We've got all of the technology set up. And I think 5 days now is going to save us a much longer lockdown later on.
Oh, Sally, you're really annoying because you make your case so well, and I think you're convincing me that you might be right, which is irritating for me. Hey, Sally, listen, I hope you're all right down in there in Camden, even though you've got those cases spreading around. Thank you very much indeed for your call. Let's go from London to Newquay. Here's Sarah. Welcome to the programme, Sarah.
Hello.
Do you agree that actually this is worth it, for just another 5 days of online learning?
Well, I just wanted to point out that in Newquay, our school is closing for 2 weeks, and yet all the other schools in the area are staying open.
Really?
I just think there needs to be something across the board so that all children are treated equally.
But isn't that... why has your school closed? Is it because the cases have... every year group is practically off? Is that why?
No, we've had 2 cases in our school. And I don't mean to, sound like I don't care about the teachers and I don't appreciate all their hard work. It's just, I think there's a massive fluctuation in what schools have got to offer. And my daughter's got to take her GCSEs this year, and it seems unfair.
Massively. You've had 2 cases in your school and the whole thing's shut down?
It's been shut for a 2-week half term, yeah.
Oh,
and as to yet, we haven't had the work sent out that they're going to have to do for the second week. And, the children have been off for so long studying at home, they're finding it, hard to concentrate at home. They need the input of their teachers. And so it's getting
2 cases
harder
does not
and harder
seem like
to study at home.
and it doesn't seem like a particularly, if you don't mind me saying, I'm sure the school's great, but it doesn't seem particularly resilient in its methods to manage this if 2 cases kibosh the whole thing.
Yeah, well, we live Cornwall. We're lucky at the moment, but we've got a very low infection rate down here. So yes, I'm wondering why we're shutting while things are good. Because if our infection rate increases, then we might have to shut again. So my thought process is stay open while we can, and let's get the input of the teachers while we can, in case down the line we have a national lockdown or something. So it just seems get it in now while we can, because they've got their GCSEs. And I'm really hoping...
Sarah, I appreciate it, and I'm sorry that the school have been in the position, and obviously sorry that people have caught the thing. But 2 doesn't feel like it's set up to try and manage it particularly well. Thank you very much indeed for the call. Jane's in Hants. Tom, we've got 65 cases per 100,000 in Hampshire. They've moved exams 3 weeks later. Now they want another week as a break. They need us low regions to keep working and paying towards higher regions. Otherwise, kids will be paying it back forever, says Jane. Come on to your thoughts in a few moments' time. We'll talk Brexit too after the news headlines. Michael Gove, the Cabinet Minister, indicating that his previously held convictions about how no trade deal would be a very bad idea have been put aside, given the reality is it now looks rather more likely that we're heading to a scenario that we're not going to get a trade deal with the EU. We'll talk about that next in a few moments. Tom Swarbrick here, 11:30. News headlines now. Here's Bill Overton.
Michael Gove says actions needed in Greater Manchester to save people's lives instead of political posturing. The Cabinet Office Minister insists he wants to work with the region's mayor and relieve the stalemate over moving it into Tier 3 restrictions. Labour's Shadow Education Minister Kate Green's told this programme, without a national lockdown, we're staring at a desperate winter. Police are going to be able to access details of people told to self-isolate by the NHS Test and Trace service. It's prompted complaints it could undermine confidence in using the coronavirus app. And the Queen's intervened to cut the sentence of a convicted killer who restrained the London Bridge attacker. Stephen Gallant helped to stop Usman Khan, who was wearing a fake suicide vest while armed with 2 knives. The weather, some mist and fog patches to clear, then mostly cloudy again with a few sunny spells. More drizzly for parts of northern England, Wales and Scotland today, a high of 15 degrees.
The fight against coronavirus. For the very latest, stay with LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Call 0345 6060 973.
Morning to you. Come to your calls on schools and whether they should stay open or not over the course of the next few weeks, whether a week should be added on to half term to try and get more control of this virus. Come back to that in just a moment. I'll tell you how you're going to get PPE delivered more quickly. It's going to be done via drone. We'll talk to the Space Agency in just a sec on that. But I want to talk about Brexit for a moment. Lots happening over the course of the last few days when it comes to the possibility, or perhaps lack thereof, of getting a deal with the European Union, a trade deal. Michael Gove, the Cabinet Office Minister, making a stark intervention this morning. He is in charge of no-deal preparations. He has made clear that he has sidelined his well-publicised concerns and is now preparing to trade on WTO terms. He has said that it's not his preferred destination, but admits there will be turbulence en route. He says, I am not blithe nor blasé about the challenges, but if the choice is between arrangements that tie our hands indefinitely or where we can shape our own future in our own way, then that is no choice at all. Raoul Ruparel joins us, economist, former special advisor to Theresa May on Europe, and now an advisor to Deloitte. Thank you for being there, Raoul. Good to see you again. Do you think we are heading towards a scenario where we don't have a free trade agreement?
Well, I think the chances of that have certainly risen in the past few days, but I think on balance it's still probably about 50-50 between whether we'll get a deal or not. I think a lot of the stuff we've seen in the past couple of days, and including Michael Gove's comments today, are tactics and strategy. I think, the European Council a couple of days ago disappointed in terms of the outcome in trying to give more impetus to the talks and the EU trying to show a bit of flexibility. And so the UK is adopting a stance to try and encourage a bit more flexibility from the EU side. That being said, a lot of this sits on top of some substantive differences between the two sides, and there are real underlying problems in the negotiations, and they are still quite far apart on issues such as, how do we control subsidies and how that works with trade between two sides, access to waters and fishing, and then also the overall governance of any free trade agreement. So while I think a lot of the rhetoric in the last few days is a bit more about the tactics, strategy, sequencing of negotiation, who moves when, etc., it does sit above this underlying problem, which means that the chance of there not being a deal is still quite high.
Yeah, I want to come on to that underlying problem in just a moment, but on the sort of glitz and glamour of all of this, the posturing of all of this, we were in number 10 when number 10 was very frustrated at various moments during the Brexit negotiations. I wonder if you get the sense in the last few days that this number 10 have become incredibly frustrated and patience is wearing thin.
Yeah, I do get that sense, and as you say, we've been there, and we both know what it feels like. I think there is a sense in number 10 that they have made some moves in the past few weeks on the issue of state aid and subsidies, and they were hoping that would lead to EU making moves on fishing in particular. But instead, the EU response has been, okay, that's good, but you need to do more. So you make some more concessions, and then at the very end, we might make some concessions. And we've been there before, as you say. It's something we've seen in throughout this negotiation of the EU, whenever it sees the UK make a move, of trying to extract more rather than moving in kind. And so I think there is certainly a frustration at those tactics and that strategy, and that's partly what's behind the approach that we've seen in the last few days.
And just very finally on the substance, there does seem to be real disagreement about issues around state aid and on fishing too, although maybe there's a way around that. But I wonder if you think they're further apart than they should be, particularly as we get towards the end of the year when we really need this deal in place. Have they got enough time to iron those issues out, do you think?
I mean, I think there still is time, but they are further apart than they should be at this stage.
Yeah.
There are some fundamental differences still, and I think one of the big ones is sort of any domestic enforcement of state aid regimes in the UK, and the UK still seems fundamentally opposed to that, and I think that is a crucial part of any deal for the EU. So that's a really big difference, and constructing that in the time we've got left in a way that suits both sides is going to be challenging.
Good to see you again, Raoul Ruparel, economist, former special advisor to Theresa May on Europe and now an advisor at Deloitte. Thank you very much for joining the programme this morning. 11:39, let's come to this. I love this idea. We talk about this on my late night show quite a bit, actually. We are the unofficial home of the future on my programme, Monday to Thursday nights at 10 p.m. So we talk a lot about space. I love this idea. This is a medical drone delivery service that is going to make it possible for the machines to carry COVID-19 samples, test kits and PPE between hospitals, and that has now been backed by the UK Space Agency. Dr. Alice Bunn is their international director and vice chair of the Council of the European Space Agency. Thank you for coming on the programme this morning, Dr. Bunn. So tell us how many drones we're going to get, what's it going to carry, what are people going to see in the skies above them, and when?
Yeah, right. It's amazing. I mean, I think what people don't understand is there is so much capability in space that we use for everyday life, right? So people think about space, it's evocative of, exploration, but actually much of what we do is about, right here, right now, everyday life. So specifically, the capability that space enables is, as you said, navigation, right? Satellite navigation, communications, and Earth observations. So using those satellites, looking down on Earth to enable us to understand what's going on our own planet. So what we're doing now is a really natural thing, right? It's part of the effort to tackle the COVID-19 disease. We'll be using those drones, as you say, for the safe transfer of PPE, test kits, and samples in what we've termed sort of air corridors. So using that navigation capability from space to make sure we can safely transfer things, minimising risks to people, because you're minimising the risks of handling materials.
And when's this going to happen from? When's the first drone going to be, flying between, I don't know, Cambridge and Oxford hospitals, perhaps?
Yeah, well, it'll have to happen soon, right? So we're hoping in the next few months.
Okay, so we've got a few months to wait before we see this thing. And how many do you have?
Again, we have to do something that's meaningful, right? We have to do something that's proportional to the scale of the disease. So we're working through the numbers. We're working through how many drones. It depends on test kit availability to an extent, and also the PPE availability. But what we hope to do is to be able to, if you like, mount an effort that really matches the demand.
Do you think that could be scaled up? So one day it's PPE and face masks and gloves and all the rest of it. The next day it is fully laden shopping trolleys that can be delivered at people's houses via drones. Is that where we're heading?
Yeah, hell yeah, why not, right?
Love it. Love it.
Already a lot of research into these technologies. So people talk about, aerial taxi routes in cities as well to reduce congestion. I mean, there's a lot ahead, right? The technology is almost within grasp. There's a lot ahead in terms of regulation and how we actually make all this work without crashing into each other. But the technology is ready.
That is, I personally find it incredibly exciting. Understanding absolutely none of it, I think the revolution that is going on, particularly when it comes to space, is incredibly exciting. I'm afraid I'm going to bring you back down to earth though, and talk a bit about the implications of Brexit on all of this. There is currently no alternative to the Galileo satellite project that the UK was hoping to be involved in, that is now no longer going to be involved in. What is the UK Space Agency? What is the government doing to try and find something else?
Yeah, that's right. So today, as pretty much the rest of Europe and other countries, we rely very heavily on the US GPS system. There's lots of open signals out there. So no cause for alarm today. What we've been doing to date is been looking at the possibility of, if you like, building our own satellite system, very much in the conventional model. So when I talk about the conventional model, you have tens of satellites in a medium Earth orbit. What we also know, though, and again, it's growing, is that our requirements for satellite navigation are changing. So much like, the previous story, using drones to transfer medical equipment, these new uses of satellite navigation are coming up every day. So what we're doing now is making sure that we look at the entirety of our requirements for satellite navigation and also take account of emerging new technologies. So we make sure that we're leading with the latest cutting edge solutions to satellite navigation.
Let me ask you just very briefly about OneWeb, which has caused some controversy amongst MPs. £500 million worth of taxpayers' money has been invested in OneWeb. This is a company that filed for bankruptcy in the US in March. It's reported that ministerial direction had to be given in order to free up the funds because civil servants did not believe that it amounted to value for money. Have the UK Space Agency done an assessment about whether OneWeb is worth the money that's being invested in it?
So it's a really interesting point, right? So what that investment showed, if nothing else, was government's really bold ambition for space. So, we're really excited by that. And I think what we see is that the rationale was indeed like a really big step. We're stepping up as a spacefaring country to understand not necessarily the immediate opportunity, but what having access to a low Earth orbit platform means in a geopolitical context. And
we all want to be the world. And Boris Johnson has talked about grabbing space by the coattails and shaking it and becoming a world leader. Words to that effect. One could see him say it, even if he hasn't. But clearly, the spending of taxpayers' money has to be done responsibly. Have you done an assessment of spend on OneWeb?
Yeah, so that assessment was done, and
what did it conclude?
It concluded that there was a good case for government equity investment on the back of the commercial returns for telecommunications. So, if you like, that was the evidence that we needed to be assured that the business case kind of washed its face. But it's certainly part of the argument for government investment was access to that long-term geopolitical advantage of having a capability in future generations of the system too.
Yeah. And one day I'd love to get you back on, Doctor, to talk about the problems that there are with militarising in space and the rules that govern space, of which there are very, very few. But we'll have to do that another time because we're out of time. Thank you so much for coming on the programme. That's Dr. Alice Bunn, International Director at the UK Space Agency, Vice Chair of the Council of the European Space Agency, on the programme. Let's squeeze in a quick call. Here's Mandy in Wokingham. Hi, Mandy.
Hi, Tom. Great to hear you.
Hi.
I listen to your show in the evenings all the time. My
you're
son,
a very good person.
My son's 15. He's in a secondary school, and they've only had 3 cases since they've been back, and 2 of those were last week. And they have not been shutting down all the year groups. They've been doing what the teacher said. They've just been sending home those people that are sitting near them. I really, really, really don't want a national circuit breaker. Really don't, because down here we don't have enough cases, and also his school is going to offer the master classes over the half term so that they can catch up with some of the exam techniques and some of the things they've picked up from when they were
But are you
off.
content, Mandy? Are you content? Not content, but because nobody is. But are you relatively okay with the notion that in sending your son to school, he may well get it?
Yes, because I think his school is doing brilliant. I mean, they're doing everything. They've got the social distancing isn't necessarily there, but they're doing face masks everywhere, but not in the classroom. They've got all the hand sanitizers everywhere. I have total faith in the school.
Okay.
And he doesn't
Mandy,
travel
really
public transport, which helps. But I'm totally content.
That clearly is very helpful. Hey, Mandy, thank you very much indeed for the call. Thank you for your listenership of the Late Night Show with Tom Swarbrick, Monday to Thursday at 10 p.m. Always good to find the listener. 0345 6060 973 is the number. More of your calls in a few moments. Tom Swarbrick here, 11:47.
This is LBC. The highest number of redundancies in almost 20 years.
The number of redundancies in the UK has soared since March, with a total now at nearly 250,000, with more job losses expected in the coming months.
Unemployment set to soar.
The ONS says an estimated 1.5 million people are now unemployed across the UK, with the jobless total now at its highest in 3 years.
Millions of freelancers and self-employed left without any form of government bailout. So how is Britain going to get back in business? Call the Cabinet Returns with me, Nick Ferrari, and Business Secretary Alok Sharma tomorrow morning from 9. LBC. LBC. Swarbrick on Sunday with Tom Swarbrick, live from Westminster.
We're going to talk about the NHS after the news at 12, how ready it is, how prepared it is, how it's coping with coronavirus, not just coronavirus, everything else that it's dealing with at the moment, particularly ahead of winter. There's a story on the front of the Sunday People, perfect winter storm, hospitals running out of frontline staff, fears over lack of tests and flu jab delay. We'll speak to two people who are working in and around the NHS, and if you work in it, how do you think it's coping? If you've been waiting for a hospital appointment or you've been waiting to get some treatment for an illness that isn't coronavirus, are you seeing that backlog that the NHS has been dealing with start to diminish, or are you just waiting and waiting and waiting to see anybody? Talk about that after 12. Julie's on 84850 this morning. Tom, my son's year group bubble, 240 boys have been sent home to isolate, thankfully only for 5 days, as the boy in question sensibly hadn't been to school in the 10 days before. However, this is the third year group to be sent home since the kids went back in September. The head and teaching staff are doing a tremendous job. If the circuit breaker is going to achieve anything, then it's a good idea. Otherwise, what is the point? Asked Julie. Come back to your calls on that in just a moment. I want to talk again about the impact that all of this and these restrictions, these tiers, are having on the hospitality sector. As you know, my late night show is the unofficial home of the publican, and so I want to focus on what it is the tier restrictions are doing to that particular part of the economy. Tier 3, of course, having an impact, but Tier 2 as well. And as you know, this is the first weekend that London and other parts of the country have been in Tier 2. Nick MacKenzie is Chief Executive of Greene King, the UK's largest pub retailer and brewer. I spoke to him a little earlier, and I asked him what he made of the support, or lack thereof, that is on offer for pubs that are in Tier 2, especially in cities where you get the footfall normally from office workers.
Yeah, look, the impact in the city centres, and particularly in central London, has been extremely challenging. The numbers are down, in some cases, 60 to 80% on our central London businesses. So that really affects viability. So the support we're getting in Tier 2 is simply not enough. We need the Tier 3 support to apply to Tier 2, and we need that to happen quickly. The Chancellor needs to look at this, I think, in the early part of next week and make some sort of announcement, because the impact on trade is severe, and we know furlough in its current form runs out on the 31st of October. So the call is do something soon, but move us more towards the Tier 3 support, because that is how we're going to be able to protect jobs in their hundreds of thousands.
Yes. And on the Tier 3 support, just to be really clear, if you're legally required to shut down, you get access to the funding. But there are many pubs, and having spoken to publicans over the course of the last few days, if they're wet pubs, they might try and serve a bit of food so they can stay open in order to see whether they can get people through the door. Should that support be applied to those pubs that are losing trade, even if they're not legally required to close?
Absolutely, because the restrictions that the Tier 2 pubs have been put into is a closure in all but name. As I said to you, some pubs are 80% down year on year, and that is just not viable. Therefore, the closure, is the effect of this is closure, and therefore the support we need is absolutely critical to be able to save jobs.
How bad is it going to get? You've already losing 800 jobs, closing 79 pubs. If a decision isn't made in the coming days as you want it to be, how much worse is it going to get for Greene King?
Look, my hope is we can keep the pubs open and trading, and my hope is that we can get the support we need, and our intention is to trade as many as we can. But clearly, as a sector, hundreds of thousands of jobs are at risk here, and no one wants to close. Nobody wants to put people out of work. But if these restrictions are going to be in place for a long time, then obviously the risk does increase. We unfortunately had to make a number of redundancies, but we have 44,000 employees that we need to protect. And across London, and you've seen this from a recent letter we sent to the Chancellor, lots of big companies employ hundreds of thousands of people, and those are the jobs that we need to protect, because these guys are working day in and day out to give good customer experiences, but are living in fear of their jobs being lost.
Tell us exactly then what support you want to hear coming from the Chancellor. What are the parameters that you want him to work in?
I think the minimum is, as I said, to apply support to those pubs in Tier 2 that haven't been asked to close but effectively are going to close. I think that's point one. I think number two is going back to a more simple, flexible furlough scheme that we will have in place up to the 31st, and actually trying to retain that for the pub sector or for hospitality generally, would be really effective. I think then we need to look more to the long term. The pub sector, the hospitality sector is brilliant at creating jobs, and that's what we're going to need when we come out of the other side of this. So support around continuation of the VAT holiday, the extension of the business rates holiday, and also a cut on duty for alcohol would really help the industry plan for the long term.
Two very quick things. Do you think that any pubs that are shut down or close as a result of all of this should be reimbursed for the money they spent trying to make it COVID secure?
Look, I think it's difficult to say we should be reimbursed, but it is true to say that we have spent tens of millions of pounds as an industry making our pubs safe, and they are safe. The numbers of cases are extremely small, but we should be getting the compensation to keep them open or to allow us to keep the staff on to then reopen when we come out of the other side.
And just very, very finally, you've talked about the difference Tier 2 is making to your business. We've seen the pushback in parts of the Northwest, Manchester and Liverpool, about going into Tier 3 restrictions from local mayors. Are you surprised that Sadiq Khan didn't push harder to try and get more money for your industry by going into Tier 2?
Look, I don't want to get caught in the politics of this, but I am surprised with, the limited amount of support London pubs and London businesses particularly have had during this crisis. You can see if you go into London regularly, like I do, the impact of the lack of tourists in the area, the lack of office workers, and I think we need to focus on, once we come to again to the other side, is how do we get people back into London and back into our businesses? And we'll be there to do a great job of giving service, giving a great experience to those customers when they do come back.
It's Nick MacKenzie, Chief Executive of Greene King, the UK's largest pub retailer and brewer, on the challenges ahead that they face. Let's come back very quickly before the news at midday to schools. Here's Zoe in Gravesend. Welcome to the show, Zoe. Thank you for picking up the phone.
Good morning, Tom. How are you?
Morning to you. I'm very well, thank you. How are you finding it?
Yeah, do you know what? Since she's been back in September, whatever her school has been doing has worked brilliantly. They've all been in their year bubbles. They have their own entrance, their own exit. They eat in a certain area. It's worked brilliantly. Only in the last week, they've had 2 confirmed COVID cases, which has only meant that a few girls have had to isolate in a year 11 and a year 8, I think. But they've got 2 weeks off for half-term starting tomorrow, which had already been decided in September. Now, she's never actually been given 2 weeks off ever for half-term. So obviously they had preempted that this was going to, maybe happen.
And I wonder, Zoe, it's a good point you make, because I wonder whether more schools would have done a similar thing in anticipating what might have been a difficult winter and just said, well, we'll make it 2 weeks. It's only 5 extra days that you're not in school, and something can be done to try and make that as educational as possible. Sorry to cut you short. Thank you very much indeed for your call. We move on after the news at midday. How is the NHS coping with the spread of coronavirus, and are we heading into what the Sunday People calls a perfect winter storm?
On your radio, on Global Player, and
Play LBC.
Leading Britain's conversation. This is LBC.
From Global's newsroom at 12 o'clock. The government's accusing the Greater Manchester Mayor of political posturing over coronavirus restrictions. It's understood there will now be a call between Andy Burnham and Downing Street later. He's resisted entering Tier 3 measures, the strictest in England, without guarantees of more financial help for businesses. Cabinet Office Minister Michael Gove insists he wants to reach an agreement.
I want them to put aside for a moment some of the political positioning that they've indulged in, and I want them to work with us in order to ensure that we save lives and protect the NHS.
Earlier, he denied a 2-week circuit breaker lockdown for England would be imposed. Labour believes that would allow the spread of coronavirus to be reversed across the country. The Shadow Education Secretary, Kate Green, also a Greater Manchester MP, has told Swarbrick on Sunday time is running out.
We can see rising infection rates all over the country, and it's very clear that the government was advised nearly a month ago by its own scientists that the circuit breaker would buy time to start to bring down the infection rate and put in place measures like local tracing. And it just seems to us now that we've got to take this action. The price of not acting is going to be utterly desperate this winter.
The wider circuit breaker strategy could be adopted in Wales. Its government's due to announce a decision tomorrow. The country's biggest teaching union backs the idea. The NEU wants secondary schools and colleges in England to close for 2 weeks later this month to curb infections. Anne Longfield, the Children's Commissioner for England, has told this programme that's wrong.
Some children, I think, it could be catastrophic. I've argued for a long time that schools should be the first to open and the last to close. Kids are just back into their routine. They're just getting back on their feet, just starting to get their confidence back. And I think to disrupt that now would have a huge and serious impact on their well-being and mental health. So at this stage, I think no.
Faith leaders are backing Gordon Brown's campaign aimed at avoiding mass unemployment due to the coronavirus outbreak. The Alliance for Full Employment was created by the former Prime Minister last month. It wants more support to help young people into work and training. The 98th Archbishop of York will be enthroned this afternoon. Stephen Cottrell will become the Church of England's second most senior clergyman during a service at York Minster. The Sunday Times is questioning why the outgoing Archbishop, John Sentamu, hasn't been made a peer, as is the usual custom. Counter-terrorism police have arrested a man over a possible breach of the Official Secrets Act relating to the leak of diplomatic cables which led to the UK's ambassador to Washington having to resign. Lord Darragh was forced to stand down last year after messages he wrote criticising the Trump White House as inept and dysfunctional got out. The Metropolitan Police has confirmed an arrest was made in London on Tuesday and inquiries continue. The weather mostly cloudy, again with a few sunny spells today, more drizzly for parts of the north of England, Wales and Scotland, a high of 15 degrees. From Global's newsroom, I'm Bill Overton.
This is LBC from Global, leading Britain's conversation. Swarbrick on Sunday with Tom Swarbrick on LBC.
Very good afternoon to you. 4 minutes past 12 is the time. You're listening to Swarbrick on Sunday and watching it as well. Global Player, YouTube, Facebook. The all-out assault on your senses continues as we straddle between morning and afternoon here on a Sunday. Thank you very much for being with us. I want to talk in a bit more detail about an exclusive investigation done by LBC. Our correspondent Rachel Venables has been looking into the issue of cladding. As you know, of course, as a result of everything that went on at Grenfell, it has become an incredibly serious subject for many hundreds of thousands of people who are now trapped in their homes effectively. They can't move out because they require particular safety certificates as a result of the cladding on their buildings. We'll speak to Rachel Venables, our correspondent, a bit later to find out the latest on that. I want to talk, though, first about the NHS. We've talked about schools, we've talked about the possibility of different kinds of measures to try and combat the coronavirus and its increases around different parts of the country. But you'll remember that back in March, one of the justifications for locking us all away was to protect the NHS. And I wonder whether if you work in the NHS, if you use it regularly, if you require it regularly, do you think the NHS needs a similar level of protecting now because of the increases in cases that we're seeing, and partly because the test and trace system, the ability to manage this, isn't where it needs to be? Do we need further restrictions to prevent the NHS becoming overwhelmed? Because, not least because, according to the front page of the Sunday People this morning, you have the perfect winter storm coming. The NHS facing a perfect storm in having to wait for flu jab vaccines to become available, a shortage, we're told, of some 680 consultants to operate life-saving ventilators, short of regular tests for NHS workers who will be forced to self-isolate when hospitals are facing a backlog of around 650,000 operations. I bet you that there are people listening to this programme right now who have been waiting for an operation for many, many months, hoping to get one maybe in the spring, pushed back to sometime in the summer. You're probably being pushed back again, aren't you, to some point in the new year. And of course, the paper reporting that there are suffering delays at GPs' surgeries of up to a month, they're saying, for this winter's flu vaccine, which absolutely critical again in trying to keep people well. arguably the most vulnerable people well during this crisis, there is a backlog and a delay in getting those flu vaccines. So with that on the cards, do you think the NHS requires protecting in the way in which it was, in the manner in which we all did during March and April? 0345 6060 973. Let's turn to Helen Stokes-Lampard, Chair of the Academy of Medical Royal Colleges, former Chair of the Royal College of General Practitioners. Thank you very much indeed for coming on the programme, Helen. Do you think the NHS requires protection, and if so, what level of protection?
Oh, good afternoon, Tim. Yes, the NHS needs protection, but I think we need to be quite clear. The only reason it needs to be protected is so that it continue to do the brilliant work that it does for everybody. So the NHS isn't just there to look after coronavirus and COVID disease. It's there to deal with the urgent stuff. It needs to be there for the heart attacks and the strokes and the cancers. It also needs to be there to work out if limbs are broken, and it needs to be there to look after people's long-term conditions. So we need to protect the NHS so that it continues to offer normal service for everybody who needs it. I think we're all aware there's a massive backlog that built up in the spring, and that needs to be tackled. And as well as tackling the backlog, we are seeing a very significant rise in demand because of coronavirus creeping up again, and that's increasing pressure. And I think people are very anxious about that. So there's a sense of fear amongst the NHS staff because they desperately want to provide the care, but they're afraid they're not going to be able to because they're going to have to focus necessarily on coronavirus patients who are very sick by the time they get into hospital.
Can I ask about, and of course people who have to enter hospital with coronavirus are ill, and there are a number of people who are on ventilation, and very sadly people die.
Yeah.
The weight of that problem on hospitals at the moment is more keenly felt in those areas where coronavirus is spreading massively, in those tier 3 areas. Is it such a problem, in your opinion, that we should be looking at measures to combat the spread of coronavirus specifically because hospitals broadly are becoming or close to overwhelmed as a result of the coronavirus cases coming in?
Yes, I think it is at that stage now. So particularly Liverpool's Royal Hospital is really under serious pressure. We're seeing it increasingly in Manchester. No, central Manchester has actually a very good density of hospitals per population. Greater Manchester less so. And Greater Manchester's certainly feeling it, and central Manchester will inevitably follow. We're seeing it in hospitals up in the northeast and west as well. And the staff there are crying out for extra help and support because also their staff are coming down sick with coronavirus or having to isolate because they've been in contact with people. And I think it's not just the workload of the rising numbers of patients, because that's going up. It's not going up as fast as it did in March and April because, of course, by and large, people are being a lot more careful because in March and April, we didn't know what we were dealing with. Now we do. So the rise in hospital admissions is smaller, but it is very significant. I'm not worried about running out of ventilators and
smaller
PPE.
But significant. Significant in what way?
So if you look at the graphs, probably the best site is the government's website showing the data for the whole of the UK, which is available to anybody to look at. If you look at the shape of the graphs, how steeply the numbers are rising, the steepness of the graph isn't as great as back in March and April, but it is definitely rising in a very worrying way.
Can I ask just finally is it an unfair question, given everything that people went through in order to try and help protect the NHS and the additional resource, unfortunately, of the Nightingale hospitals? I say unfortunately because they might have to be used at some stage.
Indeed, they're on
in all the help that was given, in all the help that was given to protect the NHS, is it an unfair question to ask whether the NHS perhaps should be dealing with what's happening at the moment better than maybe it currently is, not requiring the extra protection that might be needed?
I think we need to be clear, when we protect the NHS, it is only to protect our population. It is to protect ourselves as citizens. So it's not about protecting buildings or the individuals. It's about protecting the entity because it is a service for all of us. So in those areas where the numbers are rising, things are really tough. In parts of the country where the numbers aren't so great, the NHS is functioning extremely well and is managing to bring down some waiting times. And indeed, you'll have seen campaigns where we've been encouraging people to come forward and seek help. So if you've been sitting on something worrying, come forward. If you're in an area of very high rising cases, then actually the reality is the NHS is going to have to dial down on the other stuff it wanted to do. So your planned operation to replace your hip may not happen if you're in an area of high disease. That's just simple fact. I'm sorry.
Helen Stokes-Lampard, thank you very much indeed. Chair of the Academy of Medical Royal Colleges, former Chair of the Royal College of General Practitioners. Listening to that at 11 minutes past 12 is Dr. Rahib Ali, who is Honorary Consultant in Acute Medicine at Oxford University Hospitals NHS Trust. He's also a clinical epidemiologist at the University of Cambridge. Thank you very much for coming on the programme, Doctor. Do you share Helen Stokes-Lampard assessment of how critical things are for the NHS right now?
Thanks for having me on, Tom. I mean, I think the key question is not so much what's happening nationally, but really what's happening locally. And as Dr. Helen mentioned, there are problems in Liverpool and Manchester and some other areas. But in large parts of the country, that's not the case. And I think our response has to be proportionate to what's going on at the local level. So in my local hospital, for example, we're nowhere near where we were in the first wave in April. So I think, those restrictions that we bring in to protect all those other services, which is essential, of course. That's the key, is to protect all the other services so we can treat all our non-COVID patients as well.
Yeah.
But it should be done at a local level.
Give us a sense of how quickly or easily or not that backlog of cases is being cleared in local hospitals.
I mean, it is more difficult and it's taking longer now because of various restrictions in terms of the number of patients you can have in clinics and operating theatres and social distancing, etc. I mean, I work in the emergency department, and at the moment, the emergency department is not as busy as it was, as I said, in those early days of the first wave. But, I mean, the other key point is that in the first wave, we had shut down pretty much everything else, and that's why we were able to cope very easily in the end. But if you're trying to cope with this new wave while keeping everything else running, we can't allow cases to get to the same level as they were first time around. And in most of the country, they are not anywhere near that level. And
no, quite.
I do feel we have, we shouldn't panic, and we should, as I said, do these things locally. There are obviously downsides to having another lockdown in terms of people's health.
I was interested, Doctor, in you put out a really interesting and actually quite helpful and possibly quite calming Twitter thread in these times about the capability within the NHS right now. You say the NHS overall should be able to cope with the current levels of admissions and inpatients, particularly with the additional capacity we now have with the Nightingales and private sector. That's based on your own judgment of seeing what's around you and your own experience. So a call then perhaps to limit people's freedom in order to protect the NHS. Do you think that's going too far, that it's not necessary, that the NHS does indeed have the capacity right now to deal with all of this?
I do think so at the national level, as I said. I think at the local level, in places like Liverpool and Manchester, we have to have different restrictions in place, as is happening. I mean, the other key thing, of course, is staff. And so we may have additional buildings and additional capacity. We have to have the staff as well. And my main kind of point I've been making, both in that Twitter thread and others, is that we can't allow the virus to get too high, because otherwise we can't keep NHS services running, either because of staff absences or because of increased hospitalisation from COVID. But at the same time, we're not at that stage yet. And I understand the argument that, acting early could possibly prevent that. But given the downside of having these national lockdowns, particularly in areas where cases are low, the case really has to be made that the benefits of that lockdown outweigh its harms. I don't think that has been done yet. And until we have that... I think
that's right. I think that's right, because if you are right, and maybe it's an if, but you're a doctor, you work in it, you see it every day, that the rate of cases means that the NHS doesn't require protection right now because they're able to deal with the number of cases coming in, and they can do other stuff as well with many millions of people who have other complications aside from coronavirus. What is the justification for a circuit breaker to lock the country down for 2 weeks?
The main justification given is that if we act now, we'll prevent a longer lockdown later. That's possible, but as I said, it doesn't take into account most of these predictions we're seeing, and projections only are looking at change or reductions in coronavirus cases and deaths. What it doesn't look at is what the increase in other health harms, whether it's from heart attacks or cancer or etc. And until you do that balance, you can't say that a circuit breaker now will overall reduce harm, and that's the key calculation we need to see, and that should be the real kind of tipping point.
And as much as this is very difficult, because you're right, we don't have there's no kind of framework to calculate this stuff, although you read some awful headlines about the many millions of people affected. What is your sense, working in the NHS every day, of the impact on everybody that doesn't have coronavirus of that lockdown in March and April?
So I think there were two main problems that occurred in March and April, and I wrote about this at the time. One was that people were scared to come into hospital. And so even if they had, chest pain or weakness, they were just scared of catching the virus when they came in. The second thing is that some of them misunderstood, this protect the NHS and thought, well, we can't put an extra burden on the NHS now. And so the public health messaging has to improve, to tell people, and it has done. We've made more clear now that people should come in if they have symptoms. And we need to reduce the fear of people as well. And that's why I've also been calling for these individual risk calculators to be sent out so people understand that the individual risk of coronavirus for most people is relatively low, whereas the risk of having a heart attack outside of hospital or a stroke outside of hospital and not going to hospital is much higher. And so those individual decisions should be made based on that level of knowledge. And I mean, the final point I would make, Tom, is, we know from the first wave that the first lockdown, even on the government's own analysis, is thought to have caused more health harm than benefit, looking over the course of the very long term. And I would really ask the government to run those analyses again now, for this new proposed circuit breaker lockdown, to see if they can prove or show that there would be greater benefit of having that now. And as you've raised the point earlier as well, if cases don't go down with the 2-week circuit breaker, what happens next? Do we carry on? Becomes 3 weeks, 4 weeks, 5 weeks. I mean, last time they said it would be 3 weeks, and it ended up.
Yeah, and it's 3 months. And it's so interesting you put that across, Dr. Ali, and I'm grateful to you for it. Thank you for your time. It's so interesting you put the point across that I think, not sure I hear it all that often, to be honest with you, the point being made by staff in the NHS that, one, the NHS can currently cope with all of this, doesn't need the protection that it required back in March, and secondly, the protection that it was given back in March may have done more damage than it did good. That your operation that you needed to have, or the illness that you were suffering from, was not able to be dealt with for months as a result of the lockdown that was there to try and protect the NHS. Yes, the extra capacity was needed, obviously, when people were going, oh my God, what the hell is this thing coming in from China? Of course they needed the extra protection and the extra resource. It's there now. In a circuit breaker national lockdown, what are we saying about other illnesses, about strokes and heart attacks and diabetes and obesity and all these other problems that people have, and mental health problems too? What are we saying to those people to do if the rest of their life has been locked down as a result of coronavirus, but the hospital stays open for them, or the GP can cope with them? 0345 6060 973. Is this part of an argument against a circuit breaker lockdown? And the idea of the NHS needing protecting, do you think that is true? Do you think, based on your experience of it over the last few weeks and months, that absolutely, or indeed if you work in it, that absolutely the problems are mounting up, they are coming in at an alarming rate, and you need a circuit breaker lockdown in order to stop the problem massively overwhelming NHS services? Because based on Dr. Ali's position and argument, which I found persuasive, it doesn't, does it? 0345 6060 973. Come to your calls in a few moments. Tom Swarbrick here, 1219.
This is LBC. Swarbrick on Sunday with Tom Swarbrick, live from Westminster on LBC.
Very good afternoon to you. Front page of your Sunday People doesn't make for particularly good reading if you are trying to get an appointment on the NHS, you're trying to see your GP. Perfect winter storm, they say. The NHS facing a perfect storm of frontline staff shortages and a lack of tests for coronavirus this winter. And it's having an impact up and down the country on families like John's in King's Lynn. Tom, the stress of this is exhausting for families like ours. My seriously ill son needs to be admitted to hospital for vital care soon. If local cases are allowed to rise, the unit he attends in central London will become a COVID ICU again. He may have to struggle on in pain, says John. It's so utterly heartbreaking for you. I'm so sorry that you're being put in that position. And I genuinely don't know whether the best response to that is either to put everybody into a local lockdown so that hospitals can be freed from the burden of dealing with more and more COVID cases, or whether, as we've just heard, hospitals can deal with the current rate of cases that are coming in, but the backlog is so enormous that they're just struggling to get through it. As Brad Stevens tweets, Tom, what planet are you on? The NHS is cancelling diagnostics, treatments and operations all over the place. It will take a decade to catch up, if ever. It's not coping. Which is an interesting way of expressing how the NHS is coping, I think, because maybe with coronavirus across large swathes of the country, it's all fine, it's okay, it's got it down. I mean, in Liverpool, there are clearly problems, and that's an issue where the cases are higher, but majority speaking, the country's okay in dealing with coronavirus in its hospitals. It's everything else now. And you just wonder about the assessment that might have been made of the lockdown in March and April, about just how much damage that did to everybody who wasn't suffering from coronavirus. And if that's you, if you've been waiting for an operation, if you've been trying to get help, if you've been looking to have that thing doing that you've been waiting for some time but you now can't, particularly for cancer patients, what has it been like over the last few weeks when we have opened up, or the last few months when we have opened up? Has the NHS been able to deal with that backlog, or have you just had no help, really? 0345 6060 973. Jane's in Hatfield this afternoon. Hi there, Jane.
Oh, good afternoon, Tom. Thank you for taking my call.
No problem.
2 points. I do believe the NHS definitely needs looking after, and because I do the way people obviously behave in the flouters and everything, just coughing and splattering over everybody. And it's us people who are spreading it. We're the ones spreading it. Only a suggestion. I don't know if it's already been suggested. But I think if, for instance, a local authority may have 3 hospitals in it, maybe one of them becomes COVID solely and 2 for routine other things. That's one point, but they do definitely need looking after. I do feel like the Spanish flu, the second wave, lost more lives than the first. Sorry to sound pessimistic, but obviously
that's all right, Jane. We're all done with this, to be honest with you, aren't we? We're all absolutely fed up to the back teeth of this thing. So pessimism, I understand, but you're right. Yes, that did happen in 1918. However, we have got better therapeutics for this thing. We have got better ways than we did certainly in March and April of testing and tracing for this thing, even if it's not quite perfect or far from perfect. We've got a better system of managing this now, haven't we?
Yes, but in, say, for instance, my area, there's 3 hospitals. Obviously, I know it would take a lot of organising, but 2 of them could become routine operations and necessary operations, and 1 solely COVID only. And I just feel that because of the flouters and the deniers, that it's not real, it's a conspiracy, well, spreading it. It is going to go through. It's like a dose of salt. It really is. Unfortunately, it's us people spreading it. I think we need to shut down airports. It's a shame. Yes, the airlines are going to lose money. Shut down airports. Don't let anybody come into the country. Don't let anybody out. And just have a time. Yes, the economy will suffer, but we need to lock down until it's gone.
It's not going to go. But Jane, listen, again, here's the pessimism. Pessimism number 2. Jane, thank you, by the way. This isn't going to go. It's here, and it is here for years and years and years. I would love to have asked Andrew Lansley about it, but we ran out of time right at the start of the programme. He was the health secretary when the 2011 influenza pandemic preparedness report was published. And the report started off by saying, once a new viral thing is here and it is an epidemic, you can't get rid of it. We've just got to learn to find a way of living with it. And I'm not sure shutting down people coming in and coming out of the country now is going to do anything for that, really. Had they done that when it was coming in, sure. But it's too late. It's here. Jackie's in Chingford. Jackie, hi.
Hi. Yeah,
Hi.
I think I can hear your point, Tom, because I think the different aspect we're now dealing with, we know more about this virus, yeah?
Mm-hmm.
The biggest problem that we've got, had this government taken more leadership from the beginning and looking at the type in terms of having testing at the beginning, which we didn't have, we had to then save the NHS because unless you can test, you've got to go with what you believe were the common symptoms.
Yeah, agreed.
Right. Now, we have got more idea of what the symptoms are, and now we have more availability of testing. However, the NHS is run by human beings, not by robots. So potentially now, this winter time is a different scenario because the common flu virus is circulating as well as the cold symptoms is circulating. So potentially, if I, as a healthcare professional, have certain symptoms, I will have to stay at home and get a test. If I can get quick access to that test and a result, then I'm more likely to go back to work. But this is what the NHS is going to face this winter, which we didn't have at the beginning of spring, because there was no testing. So
and I wonder, Jackie, as a nurse in the NHS, whether what is going to come home to roost is the fact that we just haven't got enough nurses in this country and haven't had for a while, that the cut in the nurses' bursary had a massive detrimental effect on the number of people who could apply for being nurses, even if they wanted to. Now that's being reinstated. They still can't get enough people through the door to train, and actually that is going to have a massive impact when it comes to dealing with this over the winter months.
But Tom, this is not a new scenario. You've always had problems with nursing. Wimrush would tell you that because you brought nurses from the Commonwealth from the 60s. You've always had problems with GP training and doctor training because there was a point where they used to bring in junior doctors from overseas and then there was change to rules, so you could not bring doctors. You've never had enough nurses and doctors to manage the NHS in this country. Now, people could say by getting rid of the bursary, that's made it worse. Now, because there's a downturn in employment, potentially you're going to see more people, as I did years ago, took nursing as a second career change. It's not favourable for everybody. So the question is now, how are we going to deal with this pandemic? You're right, this virus is not going to go away. What this country has failed to tell people, this country was responsible for contact tracing, public health, world renowned. I was reading in Turkey, they were trained by healthcare professionals in the 30s to deal with TB. This country has lost its way when it comes to basic contact tracing. And it's ironic now, they're talking about it going back locally, because if you look in sexual health, they've always done contact tracing.
They have. You're absolutely right. And Jackie, Germany, the other thing about the contact tracing, sorry to interrupt you, Germany you look at the graphs of the spread of this thing, Germany have done incredibly well in driving this down. Jackie, apologies for interrupting you. You make a very, very good point about the problems when it comes to recruitment in the NHS. On the test and trace, the thing we haven't quite got into, and I'll be keen to come to it perhaps in a bit, just briefly, is the money. 12 billion quid on this thing. They can't account for where all the money has been spent in the contracts that have been doled out left, right and centre to try and get this thing operational. How much more money is going to be ploughed into this system? The other thing that's being reported in some of the papers this morning is that the contracts for the outsourcing of this have been written up without any provisos in to claw some money back if performance isn't good, or to remove the contract if the performance isn't up to scratch. That's bizarre. Who on earth would hand out contracts where you don't have sort of key performance things, or you have to hit this and hit that, or length of time on it that stipulate, right, we'll do it for 6 months and then maybe we'll see after that. It seems very, very odd indeed. Hey, come back to more of your calls. Jackie, thank you. Come back to more of your calls in a few moments' time. We'll talk about our exclusive investigation here on LBC into cladding as well, and the safety on the cladding around various buildings. You're listening to, and perhaps even watching, Swarbrick on Sunday here on LBC. 12:32, let's get some news headlines. Tim Humphrey.
It's being reported the Mayor of Greater Manchester will speak to the Prime Minister by phone this afternoon. Andy Burnham's so far refused to put the area into the Tier 3 level of coronavirus restrictions, saying more financial support is needed for businesses that would have to close. A cabinet minister has spoken out against the idea of a circuit-break national lockdown in England. Michael Gove says he feels it would be an error to impose the same level of restrictions on every part of the country. A convicted murderer who helped end the terror attack on London Bridge last November, armed with a whale tusk, will see his sentence cut following an intervention by the Queen. Stephen Gallant, who's 42, was on day release at an event for reformed prisoners in Fishmongers Hall when he stepped in to help end Usman Khan's attack, which left 2 Cambridge graduates dead. And the weather, early mist and fog patches will clear, then mostly cloudy again with a few sunny spells, more drizzly for parts of northern England, Wales and Scotland, and a high of 15 degrees.
This is LBC. Swarbrick on Sunday with Tom Swarbrick on LBC. Call 0345 6060 973.
Stan's in Norwich this afternoon. Hiya, Stan.
Hello, I've got a little story for you. I've got a hernia which has not been mentioned on the show so far. I got this hernia early March.
Sorry about your hernia, Stan. I can't mention everybody's illness individually, but I appreciate that having a hernia is tough.
But just listen to what I've got to say. I've got quite a long story here. The 18th of March, I went to the doctors. He referred me to the hospital. After about 3 letters and the hernia getting bigger, bigger and bigger. And now it's dangling.
Where is the hernia? Shouldn't I ask? Where's the hernia?
In my lower groin. It comes out on my lower groin. It's also coming out between my legs now.
It's a family show, Stan.
Yeah, I know. I'm sorry. I'm sorry about. I'm
it's
sorry
fine.
about that.
I'm sorry about your hernia.
But I ended up. Some days I'm in terrible pain. I can't even stand up. I called an ambulance out one day, but it was absolutely excruciating. I could not stand up. They said, "Oh, it's pointless taking you up to the hospital because they'll only tell you're on the waiting list." So I put up with that. But now within 2 or 3 days, I did get a call from the hospital for a consultancy appointment on the 7th of October. This is from the 18th of March. So I went to see the consultant. He said, "You'll need an urgent operation. It's got to be done within 4 weeks." So the next few days, I do get a letter back from the hospital saying your operation is mid-November, which is 5 or 6 weeks away. I said, fine. Within 48 hours of receiving the letter, I've got another phone call saying, I'm sorry, Mr. Stan, that your operation's been cancelled. It's been put back another 10 days. So I'm embarrassed to go out partly because,
Stan, I'm sorry.
It's really terrible. I've been waiting since the 18th of March. Now it's the end of November, the earliest. And of course, because coronavirus is getting worse, am I ever going to get this operation? I'm 71. Are they waiting for me to die so they can't do it? This is where I feel.
Stan.
I've never
tell me about have you been able to see the GP? Have you been able to get some help for the pain? Because it must be
I've phoned the GP up about 3 or 4 times, and they're only saying in dire emergencies we're only seeing people, and that's it. They just do a telephone call.
I think it's. And are you, Stan? Do you live with people? Have you got someone at home with you to help?
Yes. So,
yeah.
But
you've got a bit of support at home.
I've got a need support, yes, because it's just never ending. I've been patiently. I've never used the NHS in my life. Fortunately enough, I've been quite a fit human being, so I've been lucky. I have been lucky. I've never.
And I wonder, Stan, do you, just very finally, because I can't imagine the exhaustion that must be every single day of having to deal with this pain.
Terrible,
but do you feel sympathetic towards the NHS who have moved your operation from March to October to November, or? How are you feeling towards the National Health Service right now? Not
very good, because the operations and, people are saying, oh, they're busy. What? I don't know. What actually are the other people doing who are not dealing with coronavirus? I've phoned up the hospital several times and been told, oh, the consultant only opens up the clinic now and again. But it needed to phone the emergency services. Within a couple of days, I did get a call from the hospital.
Well, listen, Stan, I'm so sorry to hear that you're going through it. It literally is agony for you. So I'm so sorry that it's taken this long. And I do, you talk about your feelings towards the NHS. Part of me wonders, in terms of public support for the NHS, just how critical a moment this is for the organisation and public support. If more Stans are out there, many millions of people who are dealing with the effects of their illness and not being able to get support because of coronavirus, that the overwhelming support for it during March and April, completely understandable, completely right, may be starting to ebb away if people are not understanding of, or the reason isn't explained well enough to them about why their operation is pushed back time and time again. Stan, you have our support and our sympathy. Thank you very much indeed for your call. Let's turn to an LBC exclusive. On Friday, an LBC investigation exposed a company which has provided a number of forged cladding safety forms to unsuspecting customers, costing them thousands of pounds. These forms are called External Wall Fire Review Forms, or EWS1s. They were introduced after the Grenfell fire to prove any cladding on residential buildings is safe. But experts have been warning the system has become a magnet for fraud across the UK. LBC's Rachel Venables has the story exclusively for us. Rachel.
Tom, my investigation focused on a company called Specialist Facade Inspections Limited. It's pretty new and was set up last year in South Wales by a 22-year-old business studies graduate called Joshua Tedstone. Now, they appear to charge anything from £1,200 to £110,000 to survey a block or a series of blocks, produce an EWS1 form, and they say they've done more than 200 properties in locations like London, Cardiff and the home county. So we're talking about a multi-million-pound sound industry here, but I've obtained a wealth of evidence and spoken to victims across the country who say they were sold forms that were invalid and in some instances forged. SFI inspected Emily's building.
So that's when we dug out our reports and we looked up the Royal Institute of Chartered Surveyors' signature on the report online, and sure enough, we found their LinkedIn profile, and that stated that any cladding reports or EWS1 forms signed by them were fraudulent. Shocked. I mean, it feels like we're going through enough as leaseholders right now, with all this cladding business, and to now know that potentially there are people out there trying to take advantage of us and extract more money from us on top of everything else. It's just, shocking, really.
Now, Tom, the report's signature was allegedly from a Manchester-based chartered surveyor who we're calling Jane to protect her identity. I've seen 7 surveys with her name on, but when I contacted Jane, she told me categorically she didn't sign any of the documents. She never even heard of SFI, and this is a quote from her, she wouldn't know a piece of cladding if it hit her in the face. Despite denying wrongdoing, SFI recalled the forged certificates and they reissued new ones to their clients with new signatures. But on the reissues forms that we've seen, those surveyors also were not suitably qualified to do the work. SFI failed Anthony's building and sent out one of these new forms.
It takes me, 20 minutes to look him up on the internet and the letters after his name and see, all right, none of the letters he's put qualify him to do this. It's bleedingly obvious. Form number 2, also fake.
You can imagine the impact on him and his neighbours has been huge. They're now trapped in flats that they can't sell, and they're being forced to pay thousands of pounds a month for fire wardens, all based on this questionable form. Now, as part of the investigation, I provided a number of these surveys and certificates to an independent chartered fire engineer called Jason Hill, and his review presented a number of concerns, ranging from missing information that you would expect from such a survey, the way the materials were assessed, and he also questioned how 2 buildings appear to have been comprehensively assessed on the same day, even though the buildings are some 40 miles apart. We've also seen evidence that shows 2 buildings which were failed by Josh Tedstone and his father were later passed when a fresh survey was done by a second, different, suitably qualified surveyor. And lastly, I want to turn to the company's wider business model. The director's dad is called Paul Tedstone, and he himself owns a cladding firm called Uniclad. And if his son's company fail a building, he's on hand to bid to fix the problems. Now, ultimately, Tom, our investigation raises the question as to whether there are potentially thousands more victims out there across the country, people like Emily and Anthony, with companies exploiting the extraordinary high demand for the forms, real confusion about who can do the work, and the huge sums of money that are at stake. London Mayor Sadiq Khan was asked about this investigation on LBC on Friday, and he promised to act.
I think potentially the report today from LBC could save lives, because what is uncovered is potentially, allegedly, I need to use those words for obvious reasons, James, there could be people saying building A is safe when it's not, and so a family moves into there and thinks the stay put advice applies in relation to the built environment, and it doesn't. So what I'll do is make sure that both trading standards and the Metropolitan Police Service are aware of the LBC report to look into whether there are potential criminal offences taking place, but also trading standard offences taking place as well.
And the Mayor has since revealed that he has made both the Met Police and trading standards aware of these serious concerns raised in the LBC report. We also know that the Royal Institute of Chartered Surveyors are investigating the case as well. Well, we went to SFI for comment. They say they did not forge the signatures. All third parties were suitably qualified to the best of their knowledge, and they say they're not aware of failed buildings later passing. You can read their statement and the full story at lbc.co.uk.
Superb reporting. LBC's correspondent Rachel Venables on the programme. I'd be fascinated to know what central government is doing about all of this, because that is a situation that cannot stand, given the many, many thousands of people that are going to be affected by that. As Rachel says, lbc.co.uk for more details of her report. Come to more of your calls in a few moments' time. You're listening to Swarbrick on Sunday on LBC. It's 12:46.
Coming up at 1 on LBC, Majid Nawaz.
It's been revealed today that police have been given access to NHS test and trace self-isolation data. If data is the new goal, then are we being robbed blind?
Majid Nawaz on LBC. police. Swarbrick on Sunday with Tom Swarbrick on LBC. Text 84850.
Let's come to your calls about the NHS and whether a circuit breaker is required in order to protect it from the coronavirus that is heading our way and possibly even heading our way in greater number over the course of the winter. Hugh is in Pathos in Cyprus. Hi, Hugh.
Hi, Tom. How are you?
I'm well, sir. Your thoughts on the NHS and how it's dealing with it all?
Yeah, Tom, what I'm going to say is probably not going to be very popular, but I'm going to say it anyhow, and I'm going to choose my words very carefully. My mother died in a care home last year. Thank God she died last year, God bless her. She had dementia from 65 years of age, and she died, into her 70s. When I went to see her GP and asked him who was responsible for my mother's well-being, he said he didn't know. He'd have to look on his computer. I actually advised him that I knew the answer. It was him. He hadn't seen my mother for 3.5 years, or the other 6 patients under his remit, so to speak.
Mm-hmm. And
okay,
he was
before
what
COVID.
Specifically, Hugh, sorry to go into it again, but this GP was specifically required or requested or seconded to look after your mother.
My mother was 75, and like all 75-year-olds and above, they're legally entitled to have a named GP. He just didn't know that my mother was one of his patients, all the other 6 in the care home. So, and we'll spin forward now to that, because I'm sure he's got reasons why he didn't visit her or the other patients under his care for 3.5 years. But being totally and utterly transparent, I think that GPs and doctors are a disgrace. I think they should be ashamed of themselves this year.
All GPs and doctors are a disgrace.
I think that all of those who shut their surgeries, closed them. My own one closed as well in South London. I couldn't see anyone. My wife's very fortunate through work. She has private medical. She wasn't well. She saw a consultant who, by the way, said exactly the same thing. When you become a doctor or a nurse, you take an oath to save and protect life. People in the armed forces, Tom, don't choose whether or not they want to go to war when the government sends them to do their bidding. And in the same way, I think doctors, GPs who've closed their surgeries, that poor gentleman who'd had a hernia since March, they have a responsibility morally to look after those people in their
But
care.
if they literally don't have the capacity, GP and GP surgeries, slightly separate matter, because we're now talking about an operation required in a hospital.
I'm not talking about frontline NHS. I'm not talking about.
But if you don't have the bed space, if you don't have the available clinicians,
I'm not talking about the hospitals.
What are you meant to do?
I'm not talking about hospitals.
I know you're not, but in that case, in Stan's case, it requires a surgery, doesn't it? So it's not something that can be done at the GP.
Okay, I appreciate that. But not being able to see your GP, not being able to get anyone, and I've been through it myself this year, etc. But I think that they need to look themselves long and hard in the mirror and ask themselves why they signed up to do what they do. Just like our brilliant members of the armed forces who always, without question, do the government's bidding. Well, so should those
listen,
GPs.
Hugh, I think, I'm so sorry for the loss of your mum, and clearly in horrendous circumstances too. I think I see your point, actually, about the closure of GP services. You can see why in the early stages of this people were incredibly concerned about, my God, if we invite people who are already particularly unwell into the surgery to sort this out, maybe they didn't have the capacity to do it online or digitally or whatever. Hasn't that been shown to have been years behind where it needed to be over the last few months and weeks? But I do take your point that it would be, I think disgrace isn't actually the wrong word to use, to have GP surgeries shut now when we know a lot more about the virus, when things can be done online, and when so many people have illnesses, other illnesses are available, as we've been hearing, other than just COVID. Hugh, thank you for the call. Richard's in Brentwood in Essex. Richard.
Oh, hiya.
Hiya.
Can I just start with my deepest condolences to your previous caller's mother?
Yeah, poor guy. He's gone through hell, isn't he?
Secondly, I must say that I do agree that the GP surgery should be open, because that's a problem that we have got at the moment as well. But moving on to the main point that I wanted to discuss with you, with regards to the NHS, I've only got respect and applause and thanks to them, because thanks to them, My mother had a very serious illness, very, very serious, and needed a major operation, which was carried out in COVID. Yes, she had to go to hospital on her own to have the operation, which was really scary for her because she's mid-70s. But I must say that from start to finish, they've been offered via the hospital triage appointments if they want on the phone, or to come into the hospital to see the doctors face-to-face.
Well, that is terrific to hear. That is terrific to hear, Richard, and I'm glad that's worked out and your mum's all right as a result. Hopefully that can continue even through slightly more difficult winter months. Although there's Richard, thank you by the way, there's a good point here that's been made into the programme on Twitter about apparently in Australia the flu season hasn't really happened. They've had a very, very low, not particularly difficult flu season, partly because everybody's been socially distancing and washing their hands and covering their faces. So hopefully there isn't going to be a massive flu outbreak as there have been in previous years in the UK, because we've all been socially distancing and staying away from one another, and maybe the flu transmission will be much lower. Let's come to Ed, who's in Fulham. Hi there, Ed.
Hi, how you doing?
Yeah, I'm good, sir. You're a doctor.
I am, yeah. I'm not a GP, but I know lots of people that work in GP practices. I've got lots of friends, close friends that are GPs. I just want to respond to your previous caller's criticism of GPs. Sure. I think it's unfair and not very well thought out. And I think it's quite clear, actually, he's not actually got any experience of what it's like to be a GP in times like this. You know, these guys are working from 7 till 7 in the evening, 12-hour days. It's incredibly difficult and incredibly tough for these people, and they have to make really difficult decisions of what to do with, you know, what to do with people's lives. I think it's, you know, I think he should maybe have a bit more empathy for what it's like for the GPs. And the other thing is,
well, I can see from his point of view, Ed, having gone through what he's gone through with his mother, that he might not have a particularly brilliant impression. And I realise you're not a GP, but given that you know lots of them and are a doctor, would it be acceptable now for GP surgeries to close?
Well, it depends on the demand. So, you know, it depends on the demand for the GP surgery. I mean, I'm sure that the GP surgeries that have closed have good reason to close, and that reason is always obvious for the people that attend.
All right,
having worked in a GP surgery, they're very busy as well. Thanks for having me on.
No worries. Thank you very much indeed for the call. Bushra's in Ruislip. Hi, Bushra.
Hi, I'm a GP.
Hi.
And
you are a
GP. I know the programme's coming to a close, but I just wanted to say GP surgeries have not closed.
They haven't. You're right.
We are working harder than ever before. We are allowing access, online consultation, telephone, as well as seeing people face-to-face when we need to. We can't allow our waiting rooms to be full to protect our patients and spread COVID, but we are definitely open. And of course, I think I didn't actually catch all of that story, but it sounded awful. That gentleman had a very, really distressing experience. But GP surgeries are open and we're working harder than ever.
And Bushra, on the point about virtual appointments, or at least when you're doing it over the phone, or you're doing, how has that been for you? Have you been able to make that useful or good for the people that need to see you?
So if I'm talking to you and I need to see a rash, I click a button within 5 seconds. I'm watching it, we're talking on video, and if I need to actually see you physically, I've got a telephone clinic. I call the patient and I say, "Can I see you?" And they say, "When?" And I say, "Well, now," because previously they'd have to wait a month. But now the way we triage, we're seeing, on video immediately, seeing face to face on the day. We are, it's an emergency service
I
almost
think that's
now.
Great.
We're just working non-stop.
Well, listen, hats off to you. I think it's great that the digital element of it has become workable and usable and effective for people, because it was about time that started to kick in. It's one of the things that the pandemic, I'm afraid, has required happens very, very quickly, but it's probably not a bad thing that it's able to get up and running in that way. Hey, Bushra, thank you very much indeed. Look, thank you so much for all your calls, texts, tweets and emails over the course of the programme. I'm back with you Monday night at 10 p.m. for The Late Show. Swarbrick on Sunday, back with you 10 a.m. next Sunday morning. Global player for anything you missed. You can download it for free to listen live, listen again, and to a range of podcasts as well. Ian Payne's with you at 4. Right now, Majid Nawaz.
Thank you, Tom. Coming up, Downing Street has delivered an extraordinary snub to Britain's first black archbishop by failing to award him an automatic life peerage. Does our House of Lords appointments regime need urgent reform? Before that, they are the lost children of COVID, bright teenagers dropping out of education, turning instead to gang life, sometimes to feed their families. It's a tragic situation. Roughly 750,000 missing children from school in the UK. Is lockdown causing the loss of a generation of children? But first up, the National Police Chief's